All right, we're testing the microphone.
Se ve súper bien. Ahora el micrófono está funcionando. ¿Me escuchas? Hola Marlon, hola, hola. ¿Sí? Ok. ¿Se escucha bien? Acá se ve bien. Y se ve de buena calidad. Sí. Buenísimo, ajá. Ajá. Y puedes ir intercambiando de cámaras, ¿no? O graba automáticamente las dos. Ya. Ya, ¿lo tenés el link para que nos empecemos a...?
Sí, lo voy a compartir en el Facebook
Ya.
y en...
Pero me lo puedes mandar a mi mensaje para que yo te lo...
Lo mandé en WhatsApp.
¿Ah?
En WhatsApp lo mandé.
¿Ya me lo mandaste a mí?
Sí, al Rejuvenation Clinic.
Ah, ya, ahorita lo...
where's the food coming?
But I'm eating a little cookie just because I'm.
You're famished. How far are you from Tyson's?
I'm in Fredericksburg.
Oh.
So the chocolate was just really bad.
On a Saturday?
And
I remember I drove to Fredericksburg once because one of our old, my old coworker from, she used to live in Fredericksburg, and I didn't realize how far it was from here.
pretty far. I mean, it's like
Oh God, you're
It's
upstate
like-
driving
60 miles, but because of the traffic, it's
double.
yeah. So I spend most of my time in Richmond. That's where my husband is. But I have a practice.
You guys are gonna think I'm amazing and so educated. No, I'm kidding.
No, I think this is our goal is truly like to share our knowledge, and I think making more like a sculpture awareness. It's a beautiful, powerful product, and the more we talk about it, the more everyone's gonna learn. And my number one goal is to prevent having all these pillow faces.
Yes.
And I think that can come a lot from just injecting a lot of dermal filler and forgetting about like, okay, what other things we have that we can utilize.
Yeah. Also, I love to know before I start how experienced or inexperienced or new everybody is. So let's just do like a quick, if you've been in the business, if you've never injected. Is anybody here never injected? Awesome. And then maybe like 3 months, 6 months, a year, 2 years, 3 years, 5 years, 10 years? Yeah. I love it. It's perfect. Because sculpture's been around for a while. And so it's by far, I've been like very obsessed with it in the last probably 2 years. I'm getting away from doing so much dermal filler. I do think, just like she said, our industry is getting very filler happy. I love filler, like don't get me wrong, it's probably 3/4 of my practice, but I always say that everybody needs filler and Sculptra. They don't just need filler. You don't just need Sculptra. And we'll kind of go over that today. A lot of it's going to be, I think, in the assessment with the patient and talking about, I do this for all my trainings. We don't just assess for Sculptra. I will assess for filler, just full face rejuvenation. And I think it will all come together for you guys.
Mm-hmm. And keep in mind, it's more of their body and less of the foreign product. So it's just their body. We're going to produce collagen from their own body. So therefore, the results are really natural. And before we start the class, we were talking about how we both do things completely different. And I think there's nothing wrong with that. We all, would fall in love with one technique. And then when you're comfortable with that, just master that technique. And there's nothing wrong with that. I think I have respect for everyone and everyone's technique and how everybody does things different, and that's what makes us very special. You guys are gonna learn so much today, but I really want to make sure that you guys, after this, you have the confidence and knowing that okay, just paying attention to the anatomy. I'm gonna make sure we break it down so simple that maybe Monday when you're back to your practice, you're like, oh right, let's see our first sculptural patients.
Yeah, I think Sculptra, I love Sculptra for my new nurses because it gives you a feel for retrograde linear threads where you're just pushing and pulling. I don't love bolusing this product, so you get used to just having a syringe in your hand. So it is more an advanced injection technique, I think, or just a product because you can't reverse it, but it's very, very safe when injecting the correct technique. So, and I do love doing collabs, and the thing I love about collabs the most is because you will see two different ones. I do very more superficial injections or sub-Q. She does a little bit more deep, which I always say nobody's right or wrong. It's just, can you get a great result time after time? I love aesthetics because you'll go to one training and they'll be like, this is the only way you can do it, and then you go to another training and they're like, this is the only way, and they're contradicting each other. You'll hear that your whole career. Just make sure you're keeping the patient safe. You are producing a beautiful result over and over again, and will be amazing. So yeah. All right, cool. So, what do you want to talk about with a brief introduction? I feel like we went into this, but it's using PLLA. This is I'm just going to go, you'll see how I do my whole assessment, but Sculptra is a very hard concept for people to get. Who feels like they're still confused about what is Sculptra? Do you have who's like, is it filler? Is it a biostimulator? Is it a neurotoxin? If you think it's a neurotoxin, you may have to talk a little bit more. But there's a lot of patients that come in, they're like, what is this thing called Sculptra? It's PLLA. What is PLLA? If we get very technical, it is a biostimulator. It's not a gel-like substance like dermal fillers. Not all of our dermal fillers, most of them are hyaluronic acid, which we naturally make in our body. How I describe it, because I can talk about the science and the inflammatory response that it makes and blah, 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 but when you're talking to patients, you need to just know it on a simplistic level so you can regurgitate it so they can understand. So I just say PLLA or collagen seeds. Are they really collagen seeds? I don't know. Collagen powder that you reconstitute with sterile water, and then you inject it into the face, and it stimulates your own natural collagen. So if you can have a spiel that's about, I say it's your elevator pitch for all of your products that you do. I think sculpture is one of my hardest elevator pitches to get done in 30 seconds.
Yeah.
Do you have the same
Yeah, for
issue?
sure. Yeah. It's not something that you can just do like in a minute and call it.
How do you explain it?
So my approach to my patient, I always like my consultations. I first start with the aging process. The aging process book, it says it all. It starts from skin, fat pad, muscles, and bone structure. And I think these are the four main elements of anyone's facial structure, and this is how you can explain to your patient. I would love to, let me ask myself to bring out the aging process book. The last page of the sculpture book is bone. To me, bone is the foundation of anything. Like if you want to build a beautiful house, what matters the most is the structure. When the house is old, is the structure that is falling apart. So your structure is something that not many people talks about it. And your bone, especially with female, during menopause, premenopause, we lose almost 30% of our bone structure. And the reason I do my injection very deep, I learned my sculpture from Dr. Shinobe Aguilera, and he's the one, and I mean the grandfather of this whole biostimulator. So my question, just my sincere question from everyone, and anyone who can answer this, what can you offer to your patient to help them maintain this beautiful mandible and their chin and their zygomatic bone? What do you think that could be? Basically nothing, really. Like the best is like telling them like take like calcium supplement. Other than that, is there anything you can do? And think about like someone old in your family when there are like, when they were young, they were tall, and then now that they're in their late 80s, I mean they're shorter.
They're shrinking, yeah.
They're shrinking. And even with the plastic surgeon, if they want to do a facelift, but if the patient doesn't have a chin, they have to do a chin implant because they don't have that support. The simple example I use for my patient is you have a tablecloth, and if I put that tablecloth and this table, because it has surface, it's going to support it. But the same tablecloth, if I put it on a smaller table, everything's going to be hanging. So you see how important it is to maintain your patient structural support. You can give them volume, you can give them collagen, but if the support is becoming smaller and smaller, and female especially, they lose so much bone, and we have smaller bone to begin with compared to male patient. How can you educate your patient, and how can you help your patient long term to maintain their structural support? Biostimulator.
Yeah.
And I think Dr. Shinobe, 10 years ago, they were like, ha ha ha, laughing at him. And now he's proven through all his before-after pictures that his 75-year-old patient looks so much better, but still maintaining a beautiful bone support. And to me, when I talk about this with my patient to educate them, I'm like, this is what you want to preserve. This is something that I cannot give you any minute. You want to preserve it. And I always start everyone at the age of 45 to late 40, exactly during menopause, premenopause, sculptural, that I'm going to help you to preserve this. Because we may not even have a strong bone to begin with, like our mandible or our zygomatic bone. I never had a zygomatic bone to begin with. So, anything that I can do to maintain this bone structure, that's how I educate my patient, because to me, yes, skin quality is super important, but what choice do we have that we can offer to our patient to maintain their bone structure? Because this is everything. This is what any female, male could benefit from, a nice bone support.
Yep. And so that's the difference we'll talk about when we're actually injecting. The depth of injections I guess if you want to work on bone, you're going to go deeper, periosteum. If you want to do more collagen rejuvenation to the skin or the dermis, we're going to go a little bit more sub-Q. The only thing that I think all injectors can say, uniform, don't go in the muscle, don't go in the dermis, like you're doing a TB, you don't want to see the gray of your needle. So I start usually all of my patients. I love, like, my sweet spot's like 30 to 35. I'm like, everybody by the age of 40, you should be on at least 1 or 2 vials of Sculptra. Because, do you guys know the statistic? By the age of 30, we lose, does anybody know? 1%. So 1% of collagen each year. So by the age of 45, who can do the math? About 25% of collagen. That's significant in your dermis. So that's why we can go back and forth of, you can do a lot of vials of Sculptra in different planes, in different techniques to get a beautiful result for patients. And Sculptra is one of my favorites for young. When they come in, I'm like, I do not want to give you cheek filler. I do not want to put dermal filler in your face, but you're 30, you're 31. We can do some Sculptra. We can start to tighten the skin. Or, do you ever have your patients where you're like, we have done so much filler on you. I don't know what else to do. You want to do something. And it's not wrong. Let's start working on your dermis, or let's start to build up the chin or something with something else than dermal filler or hyaluronic acid. Beautiful.
Yes.
Like, what is this? All right. I love this one. So this is kind of from the book, and you guys will see me refer a lot to this book.
Mm-hmm.
I bring in this Sculptra book. Everyone should have one. Ask your rep, and if you don't know who your rep is, I'll give you guys my phone number, and I'll get your rep. And you gotta have the Sculptra book to do your consultation, because I promise you, they need something visual to see. I'm such a visual learner. If I don't see it, then I cannot comprehend. And do you ever do assessments to patients and you go through 20 minutes of the same thing, and then you ask them what they think or what they want, and they're like, so what about the Botox here? I'm like, did you hear anything I just said? So visual.
Yeah.
So this is in the Sculptra book, and what it's saying is that by the age of 18, or at the age of 18, we have this beautiful dermis, and then it starts to lose collagen at the age of 40, and you can see that slope go downward. And when they see the visual of the slope going downward, and in the book there's I think it's like a 25-year-old face and a 45-year-old face, and every single one of my patients that I say, oh, you should do Sculptra, they look at the 45-year-old face, and they're like, that's me. I'm like, look how you can get to the other way. And so it makes sense to them, the dermis. All right, what's the next one?
So let's go to the next one.
Exactly.
A little bit, how does Sculptra work? So I break it down so easy for my patient, because if you use, that's just me. I feel like you want to make them understand what is this Sculptra. The way I break it down so easy, I'm like, look, it's a copy paste. If it's injected to the dermis, it's going to help you with the collagen. If it's injected to the little bit fat pad sub-Q, it gives you a little bit more volume. And that's why off-label patient, they do this treatment for butt enhancement, and it works. Whether they need some volume, perhaps they had a BBL and maybe there's just one little area they just want to make it more even, use Sculptra. Or if their one hip is asymmetrical than the other, so it can be used for the body, and the patient gets such a nice result. And then for me, one thing, I go back again, I'm like, look, I can use filler for volume loss, toxin to prevention of line wrinkles, Morpheus 8 that we all love, like Nurse Rona. I know you love it.
I just did IPL and Morpheus to my face.
We all love this Sculptra, Morpheus 8. But then with the Sculptra, what we can do is not only give you that glow touching the skin, but then your bone support. Your bone support is important to me.
Real quick for that.
Yes,
I think, again, you guys got to get the elevator pitch down if you want to start to inject it, because at the end of the day, we are salespeople. You have to sell it first. Isn't that weird? I used to actually do sales. I'm like, oh, I gotta go back to that. But it's how you talk about it. So how I talk about it to my patients, because again, they're looking through me when I'm talking about it. I'm like, think about your lawn. When you seed your lawn, you don't see a difference right away. You wait, and then I say it because I don't seed my lawn. I'm like, I don't know how long my husband waits, but it does grow at some point. But with Sculptra, we have to wait for 3 months for the lawn to grow. So we're gonna seed the face, we're gonna wait, and then in 3 months, the lawn's beautiful, nice and green. Same thing with the face. You have to wait. You have to wait. And if you do not tell them about the waiting process, they'll come back in 2 weeks and they'll say, I want my money back. You suck. Nothing's wrong with, or nothing's different with my face. You're like, yeah, you're right. Nothing is different. Didn't I tell you that it's going to take 3 to 6 months to see? So set the stage. Everything you do with Sculptra, I think it's the hardest product for injectors because it's a lot of talking, it's a lot of explanation, and it's a lot of teaching. And so you have to have that art of teaching, selling, but once you get it down, they'll understand it. And I think a lot of people do get the seeding the lawn. I forget who taught me that, but it was in one of the Sculptra trainings that I did.
And then anything good happens through time. That's why you can see that a lot of, in our industry, I would say 3 out of 5, they have pillow faces. Because they want that instant result. They want that instant patient, especially in America. I grew up in Iran, so I have seen a totally different culture. People don't have problem with waiting, but this is a fast-paced country. Everything fast, like like your Starbucks, your coffee, everything. You want it right now. There's no tomorrow for people in this country. So they want that instant, cheap enhancement or lift or everything. But you just have to educate your patient. Anything good comes through time. And because sometimes with Sculptra, they don't see the result right away, they may be a little discouraged. So it's our job to educate our patient that, look, long term, I'm helping you to maintain your skin quality and the glow. One thing with Sculptra that I will swear on it is the glow that you receive through this treatment. Again, I have so much love. You have so much love. Ms. Rona has so much love for Morpheus 8, and we'll love it. And it is a skin tightening, but this medication is a little bit different because it also will give you that glow and help with it, smoothing the lines and some of the marinated line or nasal labia fold.
Yep, and that's where multimodality comes in. I am not just, you need one thing. I love a Morpheus package with a Sculptra package, and I call it my ultimate collagen package. I should call it like my ultimate lawn package.
How are you timing this?
That's a great question. I'm still trying to, there's no science behind it, right? So you talk to every single person says something different. And I'm like, does it degrade it right before, right after? So how I've been doing it is I will do it right after the Morpheus.
So what do you mean
Same
by
day.
after?
Like
Same
I'll
day.
do, and it depends on if the patient cares about downtime. So I don't care about downtime. So I did IPL Morpheus and then a little bit of Sculptra yesterday. Totally, I mean, a little sunscreen on and makeup, but not a lot of downtime. So I also have some patients that travel pretty far to me. So I have to be able to do things all in one sitting. I think it'd be a little bit more ideal if you probably spaced it out a little bit just for downtime, inflammation, and everything. So I have a practitioner that does it, that's one of my mentors. She does it 2 weeks after the Morpheus. And then she waits about 4 weeks for the Morpheus again. So it spreads out that Morpheus treatment a little bit longer. I think that we can all agree, again, one thing we can all agree on is not to do it right before, because I don't think you want to add heat. They have no idea what happens to it when you add heat. I would think it would degrade it a tiny bit.
One quick question. So if you have a lot of bruising, are you laser that, 2 days later?
Some patients, I just really downplay those. I'm like, look, they're gonna bruise, it's fine.
Right, but there are some patients who are just sort of like obsessed with making that follicle
Yes.
bruises it out. So
And yeah, you could. I would wait probably. I wouldn't do it within 24 hours.
maybe
I would wait about 24 or 40. 48. So you do like 2 to 3 days after. But again, there's just not a lot of science, so I hate to be that practitioner that's like, I swear by this, even though I haven't done a research paper behind it.
So how long after, somebody has Sculptra, do they have to wait to get Morpheus or something like 3 or 315 or something?
So
That it doesn't match it.
my rule of thumb is usually to wait 2 weeks
Okay.
after, but I do it very close to the heated, I'll heat the skin up. I'll actually let it cool right after. I'm not gonna do the Morpheus and then just inject right away. I usually give them 30 minutes. They usually have to kind of catch their breath. And then I'm like, all right, you ready for round 2?
How often do you spread if you had a patient that you have to do dermal filler and Sculptra?
Great question again. So I do a lot of my dermal fillers in a whole different region than my Sculptra. So for some of the patients that fly in or that are traveling, I will do it in the same sitting, but it's completely different areas of the face. So my Sculptra is all back here. My dermal fillers are all in here, central. But if I had to do it in the same plane, I would probably wait 2 weeks again.
And I think, again, everybody does it a little bit different. I feel like at the end, there's no such a thing as a wrong answer. What you're comfortable and what you're comfortable with your patient. But I think 2-3 weeks separate from each other, that gives your patient time to heal and making sure there's no complication from the dermal filler. And then I do my Sculptra. The one thing that we both have in common, for the neck area, we use mainly a hyperdiluted radius. It's a biostimulator, and I think we just get more volume from the hyperdiluted radius. I mean, I have love for Sculptra a lot, but in all fairness, when it comes to the neck, we both agree that we use biostimulator hyperdiluted radius. Educate your patient. Biostimulator, it's going to take some time. You're not going to see the result right away. The one thing beautiful about it, that the results are remarkable. Your skin quality is going to be so beautiful. Because keep in mind, patient who receives so many dermal filler, you're stretching the skin so much in one session. But that's not what's going to happen with your Sculptra. And I know in skincare, my background as an esthetician, we talk so much about Fitzpatrick 1 to 6, but in injectable, we don't bring that to people's attention. And I can use myself as an example that I can see when I do dermal filler or when I do Sculptra, it's totally different than someone, for instance, my husband who has blue eyes, freckles, and thin skin. Like if I do something wrong on his face, it shows it all because his skin is much thinner, his skin is more delicate. So keep that in mind that, okay, not many people, many people do fillers, they may look just fine. But if you have a patient in their late 60s, Fitzpatrick 1, their skin is so thin, you don't want to shove fillers to their face. It's going to stretch that skin and your skin's going to be so shiny and weird looking. So you really want to be mindful of, okay, is my patient Fitzpatrick 1 or 6? If my patient is a 30-year-old female or is a 65-year-old, 85-year-old patient who has had sunning, going under the sun for so many years and their skin quality is so poor. Someone who has a poor skin quality, I think the best treatment you can do for them is Sculptra.
Yeah. Dermis, Sculptra.
So here's a video we're gonna watch quickly. It's just like a little self-explanatory video.
And gives the appearance of an immediate correction of the defect. Massage is an important part of post-treatment care. Massage at the injection site will allow for a more even distribution of PLLA. Within days, the aqueous components of Sculptra Aesthetic are absorbed and natural swelling resolves, resulting in the temporary reappearance of the defect. But microparticles of PLLA, the main component of Sculptra Aesthetic, begin working within the deep dermis to replace lost collagen and reinforce skin structure. As microparticles of PLLA are absorbed, a collagen framework is provided to gradually restore volume. This results in the smoothing out of shallow to deep contour deficiencies that can last up to 2 years. In time, it is theorized that an increase in collagen deposition occurs, correcting structural deficiencies caused by collagen loss and fat atrophy.
Beautiful. Any questions that you guys have so far that are coming up?
There's a simple rule after receiving Sculptra. It's the rule of 5-5-5. 5 days, 5 times, 5 minutes. You just want to have your patient to gently massage that area and distribute the medication nicely through the entire face. And I always tell them 5-5-5. So 5 days, 5 times, 5 minutes.
I have to say the only patient I had a nodule, we resolved it with aggressive massage later. I do not like these rollers, these simple rollers people are using. You've got to use your hands. And I actually have a video that I have you watch of me massaging the patient. It's just my feeling. I think a lot of people are using rollers, and you just can't massage the tissue sufficiently.
Yeah, I actually do a massage for them afterwards, and I show them. And it's nice, to actually stop and talk to them for 5 minutes. If you're really busy, you're like, oh my God. But you have to really, take the time and give them a little experience. I mean, they just paid probably $800, $900 for the Sculptra. So I really try to show them that, look, you can't mess it up. They're so afraid to touch their face after getting injected. This is not filler. I keep telling them that. And they're like, wow, you're really massaging. I'm like, yes, Susie. I usually just tell them to go up and out. Just, they really want direction. Like, they really want like something clear to do.
The whole mirror.
Yeah, I'm like, just go up and out. The thing with the 555, I think it's very on label, and I think it's really good. I talk to you guys all the time in like real life too. I had Sculptra. I did not have time to massage my face 5 times a day in the little clinic, like with my gloves on. So I massage my face morning and night for just like in the shower, and I was fine. I've had a lot of Sculptra in my face. I do tell my patients honestly, I'm like, you know, you do it 555, and you want to tell them 555 because they're gonna have the Karen that's like, Brittany doesn't know what she's doing because she didn't tell me the 555 rule is like, or you know, they're gonna say like, she didn't tell me the after instructions. So tell them the after instructions, but tell them you can't do it 5 times a day. At least I do try to tell them 3 times, morning, afternoon, and night, and just 5 minutes and really get in there. Have you've had Sculptra?
Yeah.
Did you massage 5 times?
I mean, no.
Okay, I was
Like, you know how we're not supposed to put makeup on, and then right after you inject yourself in the mirror and your next patient's ready, like, okay, let me clean
I know, I didn't work here for like 9 or 12 hours
But
ago.
if, you know, I feel like if I do something wrong, I'm not gonna complain, but if there's a patient, then you feel so terrible.
Yes.
One thing that actually I wanted to talk to you guys, we got it through our cadaver course that we have this WhatsApp chat that we communicate, and then there was a question about how much do you charge? What's the charge? Well, I mean, how much do you charge? And I really think at the end, it depends on your expertise. People charge between $700 a while, $800 a while to $1,200 a while. There is no such a thing. You know, if you are an expert and you've been doing it for so long and you have so many before after pictures, obviously you can sell it for $1,200. But I think the reasonable price, how much do you guys charge?
800.
Yeah, I think that's the sweet
Yeah.
spot, because I mean, anything below that is really like, you know, you're lowering your
I agree. The
value.
caveat, which I've learned, is don't underprice yourself. 1, when you're on a special, you're just losing money. And 2, you cheapen yourself. Like, don't cheapen yourself. You guys are all here on a Saturday morning away from your family. Like, you're investing in yourself. A lot of injectors aren't doing this. And so you guys can raise your prices. So I am actually raising my price to like $950 a vial. The other reason I'm doing that is because then I can package price it, and then I can package price it at the $800 that I want to actually sell it for. And I really do think multiple vials, personally from my practice, I've seen better results. Yes.
That's my question. Have you explained the Black Heavy vials?
Perfect. Yes. So I've changed it so many times. I've done the 1 vial right when they see me the first day. I call it prime to your paint. Erica says that a lot. And she'll be like, let's just get it in, and then I'll do your 8-point lift. Beautiful. I did that, loved it. But then I see a little bit more older patients. And so then I started to do the very on-label one vial, 1 to 2 vials in the first sitting, wait 30 days, 1 to 2 vials, wait 30 days, 1 to 2 vials. Just like we do like a laser. Great results, but the whole problem again is 1, my schedule is so packed, it's hard to get them back on. That's one problem. 2, their time, them coming in every 30 days, it sounds just so daunting to them. And so I started this new thing where I'm doing 2 vials in the first sitting, seeing them back in 6 weeks, just let it simmer a little bit more, do 1 to 2 vials at that second one. And then we see them back in the 3rd month. I still see them back because I say, you're still probably gonna need hyaluronic acid in the places that I will not put Sculptra. Where we'll not put Sculptra is in your lips, in your tear troughs, obviously nowhere in the forehead. We'll do it in the temples. It's all back, like I said, it's mostly lateral and posterior parts of the face. So I say it can get better up to like 6 months. In those Sculptra book, you're gonna see it like gets better and better up to almost like 2 years really. And so I go really slow with the hyaluronic acid if I do it too quickly after my Sculptra. Does that make sense? Because I don't want to overfill them and then Sculptra take effect, and then you're like, all right, that's a little too much. But how would
per vial or sell like
I do per vial if they really want to do per vial, but I tell them straight up, like, you're just wasting your money because I really think that you need 3. So I just make a package. If they save $300, so it's kind of a no-brainer. And like, look, if you don't want to put it in your face, put it in your neck, put it in the décolleté. Even though I do like my diluted radius, so that's a whole other subject. But you can also just sell it as a biostimulator package so that you pick as a practitioner what's best for them in that certain area. So then you could do 1 vial in the face and then a vial, I mean, by 3, right? 1 vial of Sculptra, 1 syringe of Radiesse diluted, and then 1 syringe of diluted Radiesse and décolleté. And there's 3 already, but they save $300. They love a good deal. You say deal, and they're like, sold.
And what, go ahead.
Do you ever get like younger patients that you do it in their 30s to prevent like that aging?
Oh, yeah.
They would need less, like maybe 1 to 2 vials would be
Yeah.
like sufficient?
Yep, and that's for like my 30s, for sure, like 30 to 35, if they haven't had significant weight loss or just, some people are like really thin, like runners.
I just did one yesterday for an example, just bone thin, hollowed out. She's just 30, but she has these hollowed out temples, hollowed out, this submalar, hollowed out, just everywhere. You'd be putting filler everywhere, and somebody weighs like 90 pounds.
Yeah.
And so we put Sculptra.
She would need multiple vials.
She got 2, and then she's going to come back in 6 weeks.
Yep.
But already she can see she got this beautiful diffuse sort of filling out. And so that's a young person, but you couldn't put filler everywhere she would put it.
Yep, there's a indication ones, which we'll get to. The complications are pretty much the same as any injection, any needle stick, right? You're gonna get swelling,
Infection,
bruising.
granuloma, nodules, allergy reaction.
Yep. Everyone, you're gonna hear granulomas with Sculptra. It got a really bad name when it first came out. Some people still dilute it at about 5 ml. That's how they first taught us when they first came out. I don't think that people were massaging enough. They were putting it too superficial. Just didn't know how to really inject it. So it did get a bad name. So do you guys know the difference between granuloma and nodule? So granuloma has to actually be biopsied to be called a granuloma. Nodule is over 1 centimeter big. Under that is papule. So yes, so I can keep going on that whole subject because Sculptra did get a really bad name, and I love Sculptra. I'm like, who injected it on who, and how? What was their dilution? So now we do our dilutions a little bit more. At least I do. There's some people that still do
7 to
5.
8,
Yeah, I do about 8 to 9 sterile water with 2%, which we'll tell you about how
And
we
I
do
think
that
it
as
won't
well.
hurt, like if you dilute your Sculptra, like 8 to 9, I think you're safe. It's like more diluted, it's gonna prevent you from having granuloma. So there's no wrong and right. One thing I was gonna tell you guys actually, if you look around, between patients who get dermal filler, I would say at least 3 out of 7 or 8, you see all this high cheekbone and a very hollow temple. Like lately, patients are looking like an avatar. And the one area that everybody neglects is the temple. And I think temple is so critical because between the forehead, temple, and cheekbone, it has to have a very nice, smooth transition. And especially women, like a typical, that they go to, like maybe injector that they don't have experience, you can see that they have such a high cheekbone. The second they smile, you can't even see their face anymore because there's so much volume has been injected to their cheek, but the temples are screaming. So Sculptra is such a beautiful treatment to bring this volume back. And as we know, when we lose this deep fat compartment here, our lateral canthus, the brow lid, it starts drooping downward, and it makes you look tired. So when you guys educate your patient that look, by doing some Sculptra in a couple sessions, I'm able to bring this part of your face upward, and it's going to open your eyes. Not only that, it's going to camouflage because from like hills and valley, we want to create a nice smooth transition. So if you pay attention to your patient's temple, you will see that they have, especially in late 30s or 40s, there's a major volume loss, but there's this high cheekbone, and it just looks bizarre these days that people are turning to become an avatar.
The other really cool thing is Ozempic. Do you guys know Ozempic face? That's how I do it.
I see about that.
That's where they lose a lot of weight and they start to get Ozempic face. And I'm like, hey, I got something for you.
You all are not prescribing that, are you?
Yes, I am. I'm the first patient of this clinic, and I can swear on it.
How much weight did you lose?
13 pounds.
Dang, girl.
Yes.
I'm on it too. I've lost 20.
Yes.
I have no shame. I'm like,
No shame, no.
No.
I mean, when you have tried for like years and years of torturing yourself and you haven't lost an ounce, and then you take Ozempic and the last thing you think is food, and you just have to force yourself to eat. So Yeah, I haven't had anyone to complain about it so far.
Yeah. We do it as well, and so everyone's really happy with it. We're pretty strict about who does it,
Yeah.
who doesn't. Like, you know, your tiny girl who comes in wants to lose like 10 more pounds, and you're size 0. I'm not doing this. But then you have like people that just really need to lose weight, can't,
Yeah,
and
for
they're the
sure,
perfect
for
patients.
sure.
So, but with that said, the Sculptra, I love starting them off when they start Ozempic for your, you know, you can see it. You're like, you're gonna get just gone here and here. I've actually done, I think, 2 vials into my temples, and I still need more. My temples are like my kryptonite. So that's good for you guys to know. So I've done 2, and I'm still like, I probably need about, I'm not kidding you, probably 2 more. So like total of 4, and then we may have to do like a little bit of like a hyaluronic acid. Again, it's not just either or, it's and, both of them. And do a little hyaluronic acid with a little bit of a cannula action just to smooth it. I always do deep. I say there's only 3 places that I really do deep for Sculptra, personally. I do, and you'll see, I do the temples, periporous aperture, and then the gonial ankle. And then everything else I just try to nice smoothly. It's like a pan facial of just collagen all over, except for the forehead.
And when you're deep on the temple, you're just going to curiosity.
Yep. And I have them open their mouth real wide, and I just see the huge deficit where it's supposed to go. Feel for any of the vascularity that may be pulsating that you want to avoid, and then you go in deep.
About how many cc's are you putting in each temple?
Depends, right? So for me, I would put 1 vial, so you put 10 and 10. But for maybe for her, I maybe do like a 3 and 3 or 2, 1.5 and 1.5. It depends also how many vials. Yeah, deficit. I like to do more sessions for volume. I know that doesn't make sense. So I took this advanced one with Gelter, Train the Trainers, which I absolutely love for Sculptra, and it was like a aha moment for me, where she was like, not more vials necessarily equal more volume. Mm-hmm. More sessions equal more volume. Mm-hmm. Now, if you do 2, I think we're saying don't do 5 vials that's in one sitting, and that's not going to equal 5 vials spaced apart. I think there's something to be said about waiting for that collagen producing that 30 days and then catching it right then and there.
I actually have one more question.
Yeah.
Right along that topic. So when I was trained, I was taught, let's say we're starting in our 30s, obviously this is case dependent. If somebody, needs a lot of, work. Mm-hmm. Sorry, but in your 30s, one vial, mm-hmm. 40s, 2 vials per session.
Yes, per session.
Okay,
yes.
And then would you typically recommend 1 session for somebody in their 30s, 2 sessions for somebody in their 40s? Or would you do
if you're mid-30s, I like good 2 to 3. It just depends. If you're putting that in the temples, the gonial angle, the whole preauricular, submental, 1 vial for 3 times, they'll eat it up.
And the realistic expectation, you don't want to disappoint them, because that way they're going to be disappointed. You really just want to let them know that you need enough products in order for them to get that amazing result. So I would say 1 is really, you might as well just not do it. You might as well wait till they can perhaps do the 2 sessions, so that way they can get a better result. Otherwise they will be disappointed.
Yeah.
And I think the difference between Sculptra and filler, because the filler, they see the result right away. They get excited so much, so that's why they wanted more. But because with Sculptra, you're not going to see the result, so you don't want to undertreat them, because then that they really going to be disappointed.
Yeah.
So for 40s, 50s, 60s, are you always pretty much saying minimum of 3, and then we'll see where you're at?
40, 50, 60s, yeah. Yeah, and you'll see in the Sculptra book, and I always point this out with them too, it's always 4 to 5, 6 vials that these models are getting in these results. Mm-hmm. So I point that out, and they're like, oh, so you're saying I can't do this 1 vial? I'm like, no, this is very solid evidence. But the only time that I will do 1 vial is if somebody comes in and they don't need a lot of volume, and they just need maybe a little bit of glow, young, right? Maybe before a wedding or something. And you just do 1 vial, and then you follow it up with your 8-point lip. I do a liquid contour, and that they're not expecting a huge difference. They're just kind of getting that. I say it's like an elevated, very expensive facial. You're getting a little bit of a
So
glow.
what's the maximum one you can put in some of these things?
Maximum vial
4 or 5
per session?
per section?
Per session. I personally don't do more than like 2 to 3. 3 is like my max.
Unless you're including like their
Definitely.
decolletage, like you're going all the way. Otherwise, the place like 2 or 3, definitely. And then, but break it down into sessions.
Yeah.
And then, one thing we're definitely gonna do is, definitely we're gonna have a part 2 for this training. We wanna talk about the body as well, because patients gonna love you guys. Like the results from the body is incredible. Again, one, if the patient, they don't have that much fat pad to do a BBL, or perhaps they have had a BBL and then one area is asymmetrical, and they want to do the bleed. They're gonna get a beautiful result.
arms and all those things?
I don't do. I mean, I know how to do it, but mainly I do it with
Knees.
the with the yeah.
Knees,
With the knee,
underarms,
they get such a
belly.
good result.
Yeah.
But for the body, I usually do the more PSA body.
Yeah.
For the jawline and the jowls, are you guys going straight through the jowls or avoiding the jowls and kind of going like right before the jowl and then right posterior to the jowl?
If it's a bad jowl, I'll avoid the jowl.
Okay.
And you'll see again, all this is going to come together like injection technique.
Mhm.
You guys will
And
see.
I think our model, Julian, just make sure our model is ready so we can get it started. You see there in the model when we do the injection, and it's just like gonna get it 2 different like technique, and then whatever you're comfortable with. Like in my practice, I do have the Morpheus 8 that I can give my patient a nice skin quality, but I like the glow that I receive from the Sculptra, but all of my injection points are very deep. And I think you guys have a picture that it's on your table. If you look at that, all the area that it's being covered, it's like, keep in mind, a lot of your patients, they either have a beautiful mid-face support or they're extremely hollow on the mid-face support, but they have a nice cheekbone. And actually, one of my staff, she has that beautiful triple bone structure. But one thing she doesn't have is the mid-face support. So for me, it's almost like covering the lateral zygomatic bone, temple, and then the angle of the mandible, and then the pre-jaw sulcus, and then the piriform aperture. So for me, when I do my sculpture, my goal is just to preserve this maxilla, mandible, angle of the mandible. So for my way of teaching my patient, I'm like, look, I'm gonna do anything that I can to preserve this for you, because again, after menopause, during premenopause, we lose 30% of that. Like I'm like, you cannot afford losing this. This is everything. This is what's holding this soft tissue, your skin, and everything. And this is like a little bit of a, not topic related to Sculptra. The one conversation I start having with my patient is, when you're going through your menopause, consider hormone replacement. That's not my expertise, but there are so many things goes wrong and it goes against a female body because we're just a different creature, is when the hormones drop.
I know.
And that affects your bone support. You're going to lose so much bone during that transition of like all the hormone, going nuts.
Yeah.
So be mindful, like treating your patient as a whole. It's just not like giving them volumes, but really treating them, helping them to just feel youthful and feel healthy.
And we'll talk about like the recession, how the chin recesses and the gonial angle and everything on the models too. I'll draw everything out for you guys. Any questions as we're going?
What is somebody that maybe like isn't a candidate for sculpture? Like if they're allergic to sutures, or like what would make somebody not a candidate for sculpture?
That's a great question. Anybody with really severe autoimmune,
Okay.
you have to like be really, like you have to really screen for that, because I feel bad saying this, but these days there's a lot of autoimmune, sometimes not really like severe autoimmune. That's why I say severe autoimmune. And your patients will know. They'll be like, yeah, I go to this doctor, and on this med, just because it does create an immune response. So I don't want anybody to have, and really what will happen, they'll just have a lot of swelling. Active infections. I still don't do anybody breastfeeding. I don't do anybody that's pregnant.
So active infections, you mean like if they had a sinus infection last week and they're still on antibiotics, they may be off antibiotics.
I think to be careful, yeah. Yeah, active like tooth infections, skin infections. Like if somebody has like severe acne, I just won't do any type of injections through any type of infection. I would say it's just this is aesthetics. It's not worth it. Like just wait for 2 weeks to just clear up and then come back. Is there anything else we're missing with who wouldn't? That's why I love it because like
not really. I think you're gonna favor your patients, and again, educate them that our goal is to prevent having the pillow faces. Because injecting so much dermal filler over and over is going to stretch the skin. But using Sculptra, that's never going to be the case. It's just going to be giving the patient that beautiful glow, the volume replacement, and it's not going to look unnatural. It's going to give you a beautiful natural look.
I would inject it in something with connective tissue disorder like scleroderma or something like that.
yeah, you should be careful with that. I would say that would be more risky.
Just,
Yes. The only other thing that I popped into my mind was expectations for patient selection. I think expectations with Sculptra is probably one of my number one things. Because there are patients I straight up will not inject Sculptra to because I've had issues with them not liking my filler in the past and anybody's filler. Like they've gone to like 4 different people and they think everybody's just terrible and I'm going to make their life better. And I'm like, if 4 other practitioners couldn't get the result that you wanted, I don't think Sculptra is going to be the thing that's going to make your life different. So expectations, if you have the Karen, I would not do Sculptra. I think you're going to get yourself into trouble.
And so isn't PLLA essentially like sutures ground up? So if somebody like is like a surgical patient and knows that they have an issue with sutures, would you not do them, or no, it shouldn't be an issue?
I probably wouldn't, or maybe do like and this is the type of practitioner I am. I'll do like a little test somewhere. I am that practitioner. I'll be like, let me just do a little of injection here, and then see if and I'll do it like back here or behind the ear. So if they have a little bit of reaction, it's not a big deal.
And how long would you wait?
2 weeks.
2 weeks. Okay.
Yeah.
Okay.
Yeah.
And I would also probably add to that, if you use in a different form, like when you have a suture in, your body's gonna react differently because it's interpreted that potentially it's like a foreign object versus something that's going to be very dilute. Probably wouldn't have reaction.
Yeah, I've had patients that have had suture reactions, and when I was very new to, I'd be like, nope, and then I started to like dabble my feet into trying it.
Yeah.
And this is just my real life, is that we haven't had any, I shouldn't say this, right, knock on wood, but we haven't had issues. But I would always steer them more cautiously.
Yeah.
Be safe as possible.
Perfect. Thank you.
So I think our model is here. So we can go all the way that side.
This is the fun part.
And then we're gonna start with the facial assessment first, and then we're gonna show how we dilute,
Yeah,
and then we.
awesome.
Yeah.
Let's do it, guys.
Let's do it.
A lot of people do complain about this. This is perfect for Sculptra. I don't want to make her too cheesy with a hyaluronic acid or a radiesse or something of that sort. I would do my Sculptra, nice, and you'll see how I do that. Then I go down to her Paracord Factor. For sure, as we age, the distance between the tip of our nose and our lips is okay. But, and that's like exactly why I think it's there. So, Paracord Factor, a little bit of volume loss, like in her nasolabial area. Now, this is where it's like mind blowing. You're like, yes, I found my problem area, preauricular. So, preauricular and gluteal ankle all day on her with Sculptra. I find like this is the perfect Sculptra patient. Good job for whoever picked this patient up. And then from my preauricular, I do assess the jowls. She currently has jowls. And then from here, I do my marionette lines. I go ahead and squeeze just to see the skin integrity in this area. And she definitely has a little bit of deficit. Again, I have to go from the front. And a little trick that I usually do is I try to walk around them the whole time, and I'm just talking to them, looking and assessing, and always go 8 feet from the side to see the ratio of their nose, lips, and chin. I for sure say she does have a little bit of a recessed chin. I think that we could project this a tiny bit more as well and help with the whole, I would say, facial balancing, profile balancing, use of the face. Just project the chin. Finally, I do look at asymmetries as well as like putting up the brows, and then so you'll see all of my assessments are superior to inferior. Now I'm going from lateral to medial. So now I'm looking at the lateral, that I'm coming straight forward, and this is just how it's. I used to be an RFA. I guess I'm still an RFA. I used to work in the OR. You know how you use the same thing over and over because you can have your bad days. You're gonna come in like, oh, what are we doing today? So just have a very systematic assessment so you don't forget any of these things. And that's the same thing with injecting. So then I always make my way down to the bottom of the face, and then I work my way up medial. So I'm looking at her chin. Definitely a little chin projection. Submental crease. You can have just a tiny, like, she would be so good for like a little lip hydration, I call it. And she's like, oh God. But just a little something. Again, not Sculptra. That would just be another hyaluronic acid. I wouldn't project it too much because of the chin. We don't want to over project the lips because we want the chin to be awesome first. Nose is beautiful. And then the only thing that's last is I would want to showcase her beautiful brown eyes. And I would do a hyaluronic acid filler, nothing else but hyaluronic acid filler under the tear troughs, and I would go deep. I love tear troughs already, and so many of them. But it's taking me a long time. So if you haven't been injecting, I would say for at least like a year or two, just don't do the tear troughs. It's not worth it. It's the biggest complication. It's the most annoying place. But I have this weird like thing with masquerade counterfeit things. My nurses are always like, don't do that tear trough, and then I do it. I'm like, it's so satisfying, but it's annoying to work with. But don't do Sculptra. So Sculptra posterior hyaluronic acid would be all my medial, except for my Paracord Factor, and then I will go along the jawline with Sculptra as well. Any questions from that? I always assess from the face to the neck to the décolleté, and then the hands and my move the console. That's like almost Anything that you guys see that I've missed, or you guys are like want to ask me any questions about that assessment? No. What about you, my dear? Yes. Preauricular? Yeah. Yeah. So preauricular is like for me, preauricular is like right here, and then you have your radial ankle, and then you have your jowl, and then you find this the skin integrity or the chest skin integrity, and so I'm just gonna squeeze it, and then she has a little bit of hollowing in the submental, and then I will feel she's got a nice jawline hump under there. It's not too much as we age, it starts to flatten. So you can go from like an 80 degree to like a 45. What do you think? You tell me your assessment. And everyone's gonna have a different assessment.
I can do it here on the next model.
Oh, that's true too.
Yeah. I'll
Yeah.
do the next model.
Yeah. With preauricular, you're seeing the bottom most of the skin. Is that your main? Like,
Do you see the hollowing?
the hollowing?
Yeah. That's a great question. See this hollowing here? And I do want to add a little bit of hyaluronic acid cheek to her one day. And if I added the cheek goes back, like when I started acting 10 years ago, if she would have came to me and do sculpture at that time, I would have done cheeks, a lot of cheeks to lift it up, to get rid of the smile line, really made her look way too cheeky. And then I probably would have put a big bolus here, and then it just looks deformed. And so it's just over time learning how to treat the face in a very natural form. I would hope too for like movies too, it's just a good way to start injecting and getting comfortable.
And then Brady, as far as your needle choice, do you use a 23 or 25?
25.
25.
Inch and a half to start with, and then I change to, oh, that's good for you guys there. So 25 gauge, inch and a half, and move to the face, and then I go to a 23. If you haven't stopped, my everything after ordered it, so you can do it all 23, and I do like a half an inch. And then if you're like, I like 23 gauge is a half of an inch, like a quarter, heel, for all of the, well, just really for the hair workout. And you'll see, sometimes I don't have a smaller needle, I'm trying to inject on like an inch and a half. It needs, because it's just very awkward. But it'll work, it's just awkward. 27 gauge, it's gonna get clogged. I used to do, it's just like I used to do so much, change my ways so many times. I used to do only cannula sculpture. I still do cannula here and there, but I feel like I can't get to the preauricular, angle as well. Definitely can't get here as deep as I want to on very off here. And yeah. Wait here.
Everybody said 25 gauge,
1.5.
So here's practice dilution
Is this? I think this is 1 inch.
that's a 1 inch.
That's okay. Do you have a 1.5? And that's okay if you don't. That's okay. This is real life. Like sometimes in my clinic, I'm like, and then we do this.
The needle, not cannula.
Needle, 1.5. I'm doing cannula. Let me show you my cannula. If you want to do it. My cannula points. So my cannula points. I'm kind of stalling so she can not work. I'm going to go from her zygomatic arch, very posterior, about as posterior as I can get. And I usually do a 2 inch with a 20, I think it's 22 gauge, because the 27 or 25, the 25 cannula is so awesome. Even though they're 25, they're the same for needle. I don't know why, they clog easier, so I do a 22 cannula. And then I just fan, and I just try, I don't go into the orbicular oculi area, and I will just fan so nicely. Again, I try not to put too much, it depends on the patient, but if there's joweling, I'm not going to put a lot of volume there. I have the worst, what we call the accordion lines. So I love doing cannula into the accordion lines. My mom has them, my grandmother has them, so I'm like, because there's nothing else I'm going to put in those accordion lines except for Morpheus 8 or some type of tightening. Like I'm not going to put hyaluronic acid in there. And then I come from the gonial angle and I put a little mark here and then I will fan this way. And then if I can't get, which I usually can't get that 2-inch, I'll do a little bit. And how I find this one is I squeeze and I go posterior to it, so I'm almost going into my insertion point is in the jowl, and then I fan here, and then if I can get my 22 gauge from here to here, I'll try. Like I'll bring it all the way up, and I'll go really deep because I just don't like to take the patient too many times. But if not, I'll just make my last one right about here and then just fan into the nasolabial, but I'm not fanning it here. Like I would not fan that area.
You're not crossing the nasolabial, you're fanning just up to.
And then I'm like, yeah, just fanning, but I'm not going. I don't want to put a lot of volume into here, right here,
So
into
just
my no-go. Yeah, I just want to try to keep it. Do you guys see this hollowing? Can you see that? Half of the battle of an injector is like seeing the hollowing, and I just want to show you guys just so you see. So my 2-inch cannula, I'm going to start here, fan all the way down here. I'm going to do the gonial angle, fan upward, and it's nice. It's great to make across the angle of the battle. And then I'm going to go basically in the jowl almost, and then fan in this area. I'm sorry, what's that?
I get hung up with the cannula. It's real frustrating for me. I end up agreeing to it so much. A needle because I can paint the face.
I agree.
And I can't get the same result, even though there's bruising.
Yeah.
I get a much better result when using 25 gauge needles.
Yeah.
I can paint the face and go over it.
When you say you get hung up on the cannula,
It's just, it's adhesions or subcutaneous.
Oh, yes.
Like the cannula, actually not the scalp are getting hung up, it's the cannula, the cannula makes it smooth.
You know, I will say,
Everything else.
yeah, no, it's a little bit more challenging, but if you're really in that like sub-view, and it will glide pretty well, but when you are going from different compartments, that's where you're going to hit like ligaments or just the fascia or different areas where then you have to come out and you have to redirect, and it's a whole thing. We can do a cannula training one day because that is a whole thing.
Yeah, I mean, I use cannulas exclusively on just that kind of
Do you?
stuff.
You do cannula on everything?
Everything.
Yeah, I do a lot of needle. I do cannula only on my tear troughs, and I was playing around with the lips. I just didn't get the same one. I always try different things, and you guys should as injectors don't do one thing every time. You'll master a lip one way, and then you'll be like, oh, I saw this, and then you'll do a bunch of them the new way, and then you'll probably go like, oh, let's go back to the other way, and then you'll try something else.
If she had smile lines, like the accordion lines, where would your entry point be to make sure you get those that it fit with like this one and you would just go that way?
Perfect. So probably this one with the
Okay.
cannula.
Okay.
Now with my needle, you guys are gonna see. So my needle, I usually go into perfect. You guys have one. Is this 1 ml? Okay, cool. So and this is how we do things different, which is great for you guys to see. So I usually pull it up into a 3 ml, and I do three
I'm gonna
mLs.
get you a 3 ml for the second filer.
Oh, cool. Okay.
Yeah.
And
You want a
then
cannula as well? Why not?
why not? I don't care. Do you guys want to see a cannula? I was gonna let you guys, like a few of you, if you want to, feel the depth, because with a needle, how I do it, it's all about depth. So if you don't want to be in the muscle, you don't want to be too deep, you don't want to be in the dermis. So that's why like my technique's very much a feel thing. If you are in the dermis, you're gonna get the granular ones. If you are in the muscle, it's gonna clump, right? With all the movement, there's more vessels in the muscles, all the bad things. So if you want, you can. Where's our gloves? I don't even know where gloves. Who wants to try to feel? Okay. I don't know how to do this, but whoever wants to, get your gloves on. Because So who's doing sculpture now in their practice? No one?
My practices, but I'm
Not doing it?
not yet.
Not No. If they're gonna bruise down like submental area. I don't get a lot of hair from the aperture.
Yeah.
Bruising, a lot of nicknames. Yeah, nicknames that transfers. If you have that transverse artery, like it's gonna be a big one, which is the cheek area. Again, that's why your depth is so important. Going angle, like you're pretty good unless you're not on the gonial angle. Yeah, if you're on it. All right, so okay, now let's talk about with my 25-inch 1.5. It's going to be a little bit different how I'm doing a 1-inch because it's going to go. I usually go from here. I'll do like my gonial angle, and then it just depends. If they have like a big masseter, I'm not going to do a lot of. They don't need it in the masseter, so I'll go right. So I'll go right above that masseter. I mean, clearly the masseter goes all the way up past the tragus, but it's where the bulge I'm talking about. Because anything is bulging, I'm just trying to nicely, how do you say that? Like decrease the bumps and the shadows. So minimize the transitions. So I would usually just go straight up and then do a poke here, and then I would do my 1.5 poke here. A lot of different ways to do it. I think it's easier to do serial pokes where you poke, 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 because the fanning gets a little hard with the ear and as a newbie. But if you get a little more advanced and you want to try a different way, you're going to poke, go in, and then you're going to fan. And then it depends on how long your needle is. And then you're just going to go to where the fan stops, and then you're going to fan submalar. And then you're going to go in and build up the apple of the cheek, because that's probably my favorite part I say my favorite part for every part of the face of sculpture, but that is one of my favorite parts is the apple of the cheek, because I hate hyaluronic acid there except for like 1 gram, because you can see it when you smile and you get the more face. And then once we do all of the fanning, you're going to come to submental, and then you're going to fan again. Does that make sense? Okay.
For jawline though, are you ever threading along the jawline or are you always fanning?
The jawline. Threading with the jawline. So then, with the gonial angle, you come in, and I just do 1 to 2 threads because my needle's longer, so I'll just go in and do like 1 or 2 threads. Again, I don't do a lot into the jowl, and then I'll go and then do fanning here. Yeah. The big thing with Sculptra, it clogs. That is the most annoying thing. I did this biosimulator class. It's so funny because I don't have it clog a lot. It clogged only on this one practitioner every single time. I felt so bad for her. She's like, "What is happening?" I was like, I think what's happening though is because I want you to pick up your syringe, shake it, shake it, shake it, because it's going to get a little stuck. And then what I have you guys do is I have you push it out to make sure that so make sure it's not clogged before you inject. I think she was going in, and we're talking so much that I think it just clogged again. So you'll see me do this between us talking. So if you guys, I don't know if you guys can't see over there.
It's okay for our next model. She's here already.
What's that?
For as far as the time.
20
minutes is okay.
Yeah.
Okay.
Yeah, we're gonna have to really jam through this
then
with you
1 o'clock.
guys. Okay, cool. Yeah, come over here so you guys can see it. Because I'm gonna let you guys do a lot of the other side of the face. I feel people breathing down my neck. That's your son? I love it. How old are you? You look like a baby. When did you have him? All right. Go all the way up and over. So positioning of your patient is so important. So if she was like this, it's very difficult. You can go perpendicular. There are a lot of practitioners that go perpendicular. I like to just go up and over, get right on that gonial angle. I call it the hook. I hook my finger because you can feel it right there. Do not have to aspirate, and I do about. It's funny because it's not my 0.3, so I'm going to do about 0.3 in here. So I usually have my 3 mLs, and so I'm used to pushing in the 3 mLs. That's why it's going to take me a little second to reevaluate. Okay, so now I'm at 0.5. So for the 0.5, sorry, before I start, I wanted to ask you, is there any question with assessments?
You're doing 0.3 ml.
I usually do anywhere between 0.3 and 0.5, again, depending on how many vials I'm doing and how much volume they need.
How many vials are we doing this part?
2. We're going to do 2. We're going to do 1 on each side, which is going to be a good amount. So this is 1 vial that you pulled up. Ooh, I like that.
Yeah.
You know what I may do? I'm going to do this one, and then I'm going to use the 3 mLs because I think it's going to be easier for you guys to split up these. Yeah.
Yes.
So with this 0.5, I'll just do my thread, right? So up and over. And so you're going to go straight, and she should be pretty numb, but she's not. And you're going to go in this deep dermis. I know that her facial artery is deep, and you can feel the groove, so I do try to just keep my finger there. If you're in the correct plane, it shouldn't be a huge issue. There are variances. And then you're just going to do a linear grade thread like this. So this is where I go back, and then I push, pull, push, pull, push, pull, push, pull, push, pull. Do you guys know what a retrograde linear thread is? When I say push, pull, I'm saying push your syringe and pull your syringe back. So it should just be like a nice little line. And then,
And it's normal to like see it like that? After
yes.
This? Okay.
This is like what you want to see in my plane.
Okay.
That's a great question. Because people, when I do newbies and they're injecting, they're like, like, are you supposed to do this? Oh, can I do the 0.3?
0.3.
Or the 3 mLs?
Yeah, of course. Without the cannula.
All right, cool. So now I have my 3 ml, and if I had a 1.5 inch, I usually have to bend it a little bit, and I don't do a 1 inch a lot, so I'm still going to try to bend it just a tiny bit. I'm not going to lie to you guys. I do train for Galderma, and they tell you, like, if this was sponsored by them, they say don't do that. The reason is because it does thin your lumen, so you might get more clogs. That's the only thing that it does. So if I get clogged, we'll just switch it. It's not a huge deal. So
Why
then,
do you bend it?
because when it's a 1.5 inch, this angle is still, with the 1 inch, it's still really awkward. Do you see where my plunger is?
Yeah.
So a lot of this is like ergonomics, and I love being at like a new place because you gotta like get used to the bed. It's like your best friend. So see this bulge here? Do you guys see that? That's the masseter clench. I would probably say do a little masseter injections on her, just with a little neurotoxin, whatever you choose, just to thin this out just a tiny bit because we are doing sculpture today, so we don't have to, and she has great skin integrity, so we don't have to worry about her jowling too much. And I think that would thin the face. And then we're gonna add our Sculptra here. And do you see this depth right there? So I call this, the needle is under the blanket. So it's not under the mattress. Under the mattress would be, we're gonna see that probably in a little bit. And if I had my 1.5, it would go all the way up to here, and I would do a retrograde linear thread. So I'm pushing and pulling, pushing and pulling, pushing and pulling, pushing and pulling. That's what you want to see. So your new injectors are like, what do I do? And then it's water, it's sterile water. It'll just seed. So you're just seeding the face. I love to do these little bars, what I call them, are like fencing. So you're going to hold the skin as a newbie because it can accordion. She has such good skin integrity, so it's not accordion on me. And then we're going to push and pull, push and pull, push and pull, push and pull, push and pull. Now don't put it in the dermis, right? So if I am going in here, I'm getting through the dermis, I'm going into my deep dermis or sub-Q. Now I'm going straight up, and now I'm going to start pushing. So I'm going to push. Now I'm going to stop, right? Because I don't want to put it in the dermis and take it out. Now I'm going to show you fanning. Fanning's a lot quicker and easier and less pokes, but it's a little bit harder. You're going to see me getting like kind of awkward on her. So these little serial pokes, if you're doing these, probably about 1 centimeter apart. And then you're going to push, pull. Big thing. Stop about 3 millimeters before the entry point, because you don't want to keep pushing when you're fanning where the entry point is. So you're going to push, pull, stop. Push, pull, stop. Push, pull, stop. Does everybody understand why I'm stopping? Because if I kept pushing every single retrograde linear thread into this area right here, she's going to have a huge clump right there. And you don't want to do that with any product that you inject. So again, theoretically, we have our 1.5 inch, and that would have gone all the way up to the zygomatic. But this is actually kind of great because you're going to see a different injection point, a different injection style. So usually she would have all of her zygomatic arch actually injected already because it would have gone up there. But I'm going to go ahead, and this is a little bit awkward again.
You have your 1.5.
Yeah, if I had my 1.5. Do you get that? Because my last bleb, and I'll show you. So this isn't it. This is a 1.5. So my last bleb would be right here, which would be creating that zygomatic arch that I'm looking to fill. But now, since I don't have that, I'm going to go on the zygomatic arch where, like posterior, and you can do little fans here. So little fan. You see how I'm like so awkward, so you could probably make it less awkward by putting her down, but I'll have a good challenge of injecting. So we're going to go in, we're going to go about 45-degree angle. You feel it. As soon as you pop through that dirt, she has a thick dermis. You're right in this sub-Q where it's gliding really nicely. I'm going to show you guys, I'm sorry, this is usually when you're too superficial, it doesn't feel great, but I want you guys to see. Too superficial. Mm-hmm. You guys see that?
Yeah.
Right? So we want to be under the blanket. There we go. Under the mattress, super different. Now we're going to just do a little bit of fanning. And then I want this right here. So I'm going to put the rest right into her beautiful apple of the cheek. And I'm going to switch. And sometimes I'll be nice and switch my needle, or sometimes I'll switch the needle, you know. Let's see.
Yeah, how often
Fresh
do you
needle is
switch
good.
the needle?
It's nice, right?
Yeah.
It's easier for the patient.
Do you switch every syringe, pretty much?
Yeah.
Do you switch every time you go down to bone, too?
Yeah.
Okay.
I'm not going to tell you.
Okay.
So I probably should, because I do dull my needle out. Give it just a piece of gauze.
Yes, Claudia.
So funny. I saw the mic. I'm like, what is on my face? All right, so we're back. So do you guys see this again? Half the battle is just seeing the deficit. So she should be a little bit numb here. I like to just do a little bit of a poke. And we're going to just push, pull, fan, push, pull, fan, push, pull. And they're pretty hefty pushes. Like, I would never push my hyaluronic acid like I am pushing this right now. Smile for me. Ah, beautiful. I'm just seeing where the apple actually ends up when she smiles, and then relax, and then smile, and then relax. Sorry, I gotta see. Smile, and then relax. Okay, cool. So I can build this up a little bit more. I didn't want to go too much over here because I didn't want to make her too cheeky. I was trying to figure out where that apple anatomically should be. So again, that's just a good lesson for you guys when you are injecting. Please have them express, even if you're doing Sculptra. It's more important when you're doing your hyaluronic acid that's filling exactly where you're putting it and pretty much not going anywhere. So you want to stay there. All right, perfect. So I'm always watching, like, how much am I injecting? How much do I have left? So if I'm doing this in real life and I only wanted to do 1 vial on her, I would have done 3 mLs on this side, 3 mLs on this side, 1.5 in the temple, 1.5 in the temple, if she needed temple. I don't think she needs temple. Would you do temple on her, even if she like really doesn't? Like some people do it just for the tightening or just for the lift.
I would just do a little bit.
A tiny bit.
Yeah, and
And
I
that's
think
great.
it's just because like especially within like 40, we do lose some like deep fat
Mhm.
compartments. I think it's just to really helping to maintain her volume.
Yeah, and that's it's two different perspectives. And I probably on her second one, this is a good thing too, is that the first one I try to really get those problem areas, and this preauricular is just jumping out at me. So I'm like, I want my products here, there. And then in the second session, I'll start to do the little, I call it the icing on the cake. I'm like, ooh, let's do a little temple. Okay, now let's do our piriform saphenous a little bit more because we want a little bit more volume there. So it's not the same way each time. Since we're doing one vial and one vial, it's kind of easy in your head. You're going to put one vial over here and one vial over there, but you do want to make up for any asymmetries. If she has severe, and I was looking at that while I was assessing her, if she had any severe asymmetries, like there's some people I could put like a whole syringe on just one cheek just to even them out because they sleep on it. They just have different anatomy. So I always say we have one like bigger boob, bigger hand, bigger foot, bigger cheek, bigger lip, like all the things. All right. So then you could go. So I usually finish this area. Then I go to my piriform saphenous. So I'm sorry, honey. And this one always hurts. And I wanted to show you on an inch. See how it's a little bit awkward on this longer needle? So imagine an inch and a half. So you could be fancy and get a shorter one. I don't think there is a shorter one where it's a half
So you
inch.
use a half inch.
I do.
And it
Were you
still goes
young?
down to bone even on like older people, like 60s and plus?
I do.
Okay.
I do because again, they need it.
But I
because
mean,
they're
you can reach
assessing.
the bone.
Oh, yeah.
Just the half inch. Yeah, because sometimes it gets so.
It does, and some of them are so gaunt
Yeah.
that it's like whoop right there, and then
Okay.
some of them
Okay.
are deeper.
Yeah.
But you'll get
Okay.
it.
Okay.
No aspiration needed.
I don't with my Sculptra. There are a lot of people that do with my Sculptra. If it's very rare to get a vascular occlusion. Again, you see, I don't put a lot in. I am more of a serial puncturer with smaller boluses than I am one poke. And my patients tell me that all the time. They're like, man, you poked me a lot more than last practitioner because I'm just putting all these little dollops everywhere.
Even for piriform, you'll do multiple pokes in piriform?
So if I'm on hyaluronic acid, I'll inject or I will aspirate, and I usually do like 2 injection points in my piriform saphenous instead of just doing one or like 0.1. People usually do, right? I usually do half, but I gotta get going.
And what do you do with Sculptra? Sorry.
You're good. Depending on how much of a deficit they have, I do about 0.5.
Okay.
0.5 to 1 sometimes if I'm like, oh, this is what needs
1
it.
ml.
Yeah.
Okay.
But I usually do 0.5.
Okay.
Okay, sorry. Yeah, you're good. And then again, if it's 1 vial versus not 1 vial, you really just want to evenly distribute this across the face. So I'm like, I have 1 more left, which is great. So I'm actually going to do a tiny bit of just like straight into the nasolabial. So I compromise the skin. I find where I want to go. I actually do have my bevel straight down, so it's not going into the area I don't want to. And this will be really nice with her. I'm going to go not too deep, right under that skin. And then this is just a personal thing that I do. I don't put that little foam that's always there in because that's usually the reason for the granulomas or the nodules. So I just leave that, and that also just gets very annoying to inject. So then we're going to, is this my 1.5 inches? No, that's my cannula. So I'm going to switch this, and let's take this one. I still do like it. It's just like habit. My ankles. And then we're gonna shake. I'm going to pull back on my syringe, and then I'm gonna go back up just so that it's coming out. Make sure it's coming out.
Up or down, depending on where you are.
I do. Mm-hmm. And that's just it's more habit because that's how I do my hyaluronic acids. I really think you'll be fine if you accidentally put your bevel facing the wrong way with Sculptra. Because it's just, think of it, it's just seating. Don't beat yourself up. You're like, oh crap, I did like 0.1 more here. Like it will all be okay. Just kind of get the general volumes the same on each side and just nicely, evenly disperse it, I think is the biggest thing. So we're going to compromise the skin. I know that I'm going to have my injection point here because I'm not going to put a lot of product where I'm going, my entry point. Usually my needle would go all the way here. And then I'm going to push, pull, push, pull, push, pull. You see kind of bubble? And then you see my, that's like, if I get real technical, do you see how it tethers down? I'm a little bit too superficial. So then you can come back out. And then I go down. Perfect. Push, pull, push, pull, push, pull, push, pull. And then, I'm sorry, hon. It's a little harder in this area just because it's thinner. You can see this vessel, so I'm trying to stay at the right depth. And then I'm like, I'm not going to go straight up into that vessel. Do you guys see the vessel? It's very clear. But if you're at the correct depth, if you're not too deep, that vessel is a lot deeper, and then it becomes more superficial. This I want to go into, but I don't want to go too far up into her oral commissure because of the orbicularis oris, but I am going to sneak a little bit of product up there. I'm going to say 1 finger breath away, and I'm going to keep it moving. With aspirating, I am keeping my needle moving this whole time. Therefore, I think you're not wrong for aspirating, but do I think it's 100% necessary? No. When you're moving your needle. You get a little bruise there. And so when you see a bruise coming, hold tight. And I do tell my patients you will bruise with Sculptra. You see how many times I'm poking them? If they don't bruise, I'm like, you're superhuman. And then just hold with a lot of pressure. And then I look and I have about 1 ml left. So what am I going to do? I'm going to go back. I'm going to assess the face, see how it's looking. And I just am obsessed with trying to get this preauricular area right now. So I'll probably just concentrate on the preauricular. Then when she comes back in a month or 6 weeks, we'll probably see how the preauricular, it's not going to be changing that much because it's only 30 days, but I'll probably still come back here. The other little tidbit that I love with Sculptra is you can do it all back into the hairline. And so there are some patients that I'll poke my cannula here. I do cannula into the hairline, and I'll straight up go all into the hairline again to get that lifting.
Do you do nasolabial as well? Or just?
Nasolabial? Yeah. With cannula or needle? Is that what you're asking?
Well, you treat it in general with Sculptra.
Yeah, so I just did like a retrograde linear thread right here. Yeah. You're totally good. So again, I'm going to try to get this preauricular area just a little bit more. Let me see real quick. Oh, look at you. Beautiful. Let me just show you guys temple, because now that I built this up, I'm like, we can do temple for sure. So open your mouth really wide. Perfect. So she has a little bit of volume loss right here. You can see this huge vessel. And then we're going to palpate for any of our superior temporal artery. It usually comes up a little bit higher. Yes. Right. There it is. A little higher. Perfect. So we're going to open her mouth wide, just so you guys can see this. I'm going to pull. I love pulling up the skin, and then I'm just going where there's that deficit. And I love to actually spin my bevel around to get this nice even distribution. And I am on periosteum. I'm coming out very slow. And then I say, yay, I didn't hit the vessel. And then that's about it. So I do have about 1 ml left from that other syringe. So we will steal it from this one because I still want to do this postauricular and jawline. So I'm going to show you guys gonial angle again, up and over, because I could definitely do more. 0.3 was like pretty small for gonial angle. So I can go in and I'm going to do about there we go. And the gonial angle will just stop you in your tracks. That's how you know. If you go more than a few millimeters in the skin, you're probably past it. Come back out, just realign. It's okay. And then we're gonna see this little deficit here. I'm just going to put a little bit more product here, just to get us a nice even distribution of the collagen seeds. Come out, and voila, that's half of the face. Okay. So I'm gonna have you guys try probably just a few little probably just one retrograde linear thread because there's a lot of you, and then I know there's the other model.
For time's sake, is there a way we can try it on the second one?
Yeah, let's do it. Do you want me to do this one real quick?
Yes.
Perfect. Any questions as I get this one done? So what am I doing every time I pick it up? Shake, 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 shake.
Do you have like a hot dog warmer, or do you have one of those little vibration things?
Oh,
What
yes.
do you use at your practice?
I do. I'm gonna just have alcohol. I have my MA got it off of what did she get? It's Amazon, definitely. I think she said it's like a nail polish shaker, which was pretty clever of her. I actually went to high school with my MA, and we won state champs, and we were for soccer. And it's so crazy. It's wild. I moved out to California. We kind of lost touch. I moved back. I started my own practice. And she called me up and she's like, hey, I'm an MA. I'm an MA school. Because she was a stay-at-home mom for so long. She's like, I just need some experience with like medical stuff. I'm like, dude, I'm doing Botox. I don't think there's a lot of like, medical. Like, I think you're looking for like other stuff. She's like, no, I think I just want to like come and just see if I can watch somebody being stuck, because she passes out at meals, and that's hilarious. So the first few times I did it, she'd have to sit down, but now she's like full rolling, like pretty much running my entire clinic.
I love that.
It's crazy how full circle it comes. All right, so gonial angle, up and over. Why? Because when I do this, I can't get to her. So up, over, and always move her. Any questions as I keep going? Right there, stops me in my tracks.
Yeah.
I'm gonna do about 0.5 because I have 2 syringes, and then we're gonna go straight in. I like to go straight in again. I am below, under the blanket, not under the mattress. I like to poke. My first poke is gonna like numb everything in that area. So if you can go back into that area. Oh yeah. Fresh needles on every one. Hold on. I'm used to changing them out sometimes. It depends on who sets up the room too.
For your sculpture treatments, how much like time do you block off, like the filler time, less?
I'm still trying to get that together. I'm like the worst with my timing. It should be. You should really probably, as a beginner, do. Okay. I think it's like 30 minutes.
Okay.
But again, where do we go?
And this is not including consult, correct? This is just the.
Yeah, for beginners, you should do 45. Sorry, I gotta get your hand out of the way. I'm sorry, honey. I could probably put you back. Let's try to get this angle. So I'm trying to get this angle, and what's getting, and this is just real life, is the plunger gets in your way when it's really full. So we're going to pull the skin back, keep it nice and supported, and then we're gonna push, pull, push, pull, push, pull. I'll show you a little bit of fans. I did serial punctures on the other side. Push, pull, stop. Push, pull, push, push, pull, stop. Push, pull, stop. Push, pull, stop. And you gotta be careful. You don't want to go too deep. What's under this? Rotted. So I'm just gonna measure so I know that the product went from here to here, and then it went from here to here, so it fanned. So I'm just gonna overlap it. Do you guys see how I found this point? Because when you're not with me in a training, I always found that so hard. I go to a training and then they make it look so easy, and then all of a sudden I get there and I'm like, I'm like lost in a forest with my my marks. And right there, she'll get a little bruise. And I just tell them straight up, I'm like, look, you're gonna get a bruise right there, and then you just hold it. And then if you can multitask at the same time, I'm gonna go ahead and do the zygomatic arch. So I'm just finding, so for my zygomatic arch, I usually take a peace sign. I find the borders. I come all the way back. And then I'm trying to hold as I do this. And then I'm going to go really close to that hairline. And then we will fan as well. Get that hair out of there. Let's see. Oh, not bad. Perfect. And then the whole time I do Sculptra, I'm looking, how many syringes do I have? What areas did I just do? As a beginner, I used to do this, and it's very good for you guys to do this. Put your 3 mLs out, or you can even put them in 1 mLs and just be like nasolabial with your piriformis aperture, preauricular. So you can, because it does take a while to get to near my push. And I've been with practitioners that they were like, I just put it all in one area because they didn't realize it. So if you need to start with 1 mL, it's probably the smart thing to do. All right, so and the other thing you just have to remember where you went previously so that we evenly distribute. Now there is a vessel that I told you guys about. What's the vessel that goes here? The nice artery. Yeah, the transverse artery. You want to stay away from that. And then we know not to go. I do not go deep mid-pupillary, even if it is Sculptra, because of infraorbital, right? It comes out of the infraorbital. All the arteries. All right. And the reason that I'm doing this a little bit more is the apple of her cheek. Again, this area is where I want a little bit more volume. This is going to be my tightening. And then, again, I'm looking at how much I have. I want to do my piriformis aperture. So we're going to go straight down. I'm sorry, honey. And then I'm going to angle a little bit more medial. I know. I did about 0.3. And then we're going to go, my bevel's facing down. I know. And then, voila. So, real world, I can probably do Sculptra in like 10 minutes, which is really sometimes not good that I do it like that. And then, numbing is what takes so long, Sculptra. Yeah.
Is that 45 minutes, including the numbing time?
For my appointment slot. So
Yeah,
how I tell my
for-
patients, no.
Okay.
So, So how we do it is we have it as a 45-minute. We've had actually a 30 minutes, and I tell them to come 15 minutes early, and then I have them numb for 30 minutes, and then I have about 15 to 20 minutes straight.
Okay.
That's what I do. How do you guys, whoever else does Sculptra, how do you guys do your?
I've been using cannula, but I've been having issues with the cannula sometimes, so I switched to needle.
Yes. How do you do your appointment times?
I do an hour, which feels
That's
like
great.
a really long time, but like, I feel like because I don't have an MA, so like from when I have to mix it and plan and talk to them and educate and inject, like it's an hour.
And patients
Pictures
love
and
that.
all that too. Yeah.
Yeah.
I know.
Yes. Okay. So yes, I'm not including that.
Oh,
Send
okay.
Picture.
Yeah.
I don't do that.
Okay.
Yeah.
So
Oh,
that's
wait a
just
minute.
your time.
Yes.
Is 30 minutes. Okay.
Yes,
That's
yes,
not the.
Yeah, hour for all of the other stuff and
Yeah.
injecting. That's what
Yes.
I have blocked off.
So bevel, I just wanted to go down, and then again, oral commissure. I want to be about 1 breath outside of that oral commissure, and I'm going really light. Again, I have seen practitioners, some of them go straight up. Not saying they're wrong whatsoever. Just trying to be a little bit more mindful of those sphincters. All right, cool.
Do you think it would be beneficial to do cannula on bone, like in the zygomatic area, and then to go in, more superficial dermis and kind of double layer?
Yes.
Okay.
They just got, this is very watery, so I can just get out. They just got an indication, Sculptra did, for, sorry, I don't want to get this on. And I will just massage with a little blood on her. It's like PRP, right? So Sculptra just got an indication for deep injections, like periosteum, for restored volume in the cheeks, which they didn't have before. I'm very interested to see how people start to alter their injections because of that. I worked for a facial plastics and a plastic surgeon, and he kind of gave me a hard time about Sculptra Deep because he did a deep plane facelift. And he said that it was like goofy and like concrete when he tried to do the facelifts. So that's one of my main reasons for not going deep. However, there's a lot of injectors that go really deep and they get beautiful results, and there's those patients that are never going to get a facelift and they'll get beautiful results. So if your patient is never going to get a facelift, I might play with the the deep injections. I used to do all my sculpture deep. Yeah. So I'm telling you, and I did it like every single way. I've done it every single way. And they were great results, but I changed it because I was working for plastics.
Right.
Yeah.
Was that the radius too? Were you doing that deep too, or no?
As a biosimulator, when I dilute it, no. I do sub-Q, and I do that mostly with cannula. So it's funny how I do it different. But again, I do mostly radius here and here.
Not the face.
Yeah. Well, that was fun.
I don't even know where massaging you.
So we're gonna do the 5-5-5 rule. So 5 minutes, 5 times a day, 5 days. You are gonna massage your face. You can't mess it up. You're just gonna go up and out in the sphincter areas, which is all around the mouth. I do like a little circular massage. Do you feel my pressure? Yeah, I want you to really massage that. You do not want your collagen to grow in clumps. You really want it to be nice, evenly distributed. This is not dermal filler where I'm sculpting your cheeks and I don't want you to touch them. This is just a facial of the collagen seeds. And I didn't really go through my whole spiel of how I talk to my patient of my treatment plan because it's not sense, but I would explain all of this on the free end. And the whole lecture, I pretty much say in my consult, my first one. Yay! Any questions? What do you guys think? Are you scared? Is it hard? Or does that look easy? I think this is easier than lip filler.
Yeah.
I think lip filler is advanced.
Writing it everywhere.
Yeah. It's like you're just watering the face.
Yeah.
The little collagen seeds.
But the only place you're going down to bone is temple, gonial, ankle, and piriform.
Yep. Okay. Personally, me. And now you'll see it like completely different, which is so good.
Question.
Yeah.
How come you didn't do my concept on this way?
That's a great question. Because I lost track of time and I was getting a little
And
bit
I
rushed.
I would do that.
You actually do. I'll take a little bit. Yes, I have some that's my fault.
Some people
Yes, you can do that. So the 1 up and 1 over or that we're talking about. Oh, they know that.
Oh my
They know
God.
that. But do you see, like, I didn't do what I say. Say, what does it say? Say as I do, not as I say. I did not do my normal fashion because I think the 1.5 inch, like, I'm just such a robotic person. And I usually do the same exact thing. And then I was like, oh, I guess I will do the temple. Didn't do it on the other day.
So do you find after they do the 2 sessions and you tell them once a year? Is that what? Like,
Yeah.
what do you tell
I tell them it's just your new birthday present to yourself. Tell your partner you have to put in your financial budget and you come once a year and it's your birthday because they'll remember it. And they get really excited. They're like, oh, my birthday present. But I tell them we can take the ball for you too. I think I need this. You're going to use it? Okay. All right, so temple again. So what are we going to do? We're going to have her open wide. And you guys see the deficit? And that's pretty much that 1 up and 1 over. So you find the suture line.
Yeah.
And then you go 1 up and 1 over, and you just avoid any vessels. And that is like literally right where she is. Closed. Yep. 1 up and 1 over. Go ahead. Open. The reason that I keep her mouth open while I'm injecting is just to avoid the muscle, the temporal muscle. If you go through the temporal muscle, it just is really sore. That's it. Now we're done. Good job. Thank you for that reminder. I love that.
So the temples, do you prefer
How do you feel?
a slit truck versus like a non-acid?
Yeah. Okay. I will say though, if she was like feeling I probably just need like a radius, straight radius, down periosseum. It's very old school to do it. Call the shotgun. Thank you. Yeah.
You did so good. I get this stressful. How do you feel?
Well,
You did excellent.
You do?
Yes.
Very careful.
Yeah.
And then nervous?
A little bit. I mean, I just started with Delta, what, a year and a half ago?
one up from the brow.
Waited until I was 52, I'm 53 now, so.
I'll tell you guys, if you do
We're late in the game, but I'm
Claudia?
do it, like, from a textbook and
All right, so let's do this, guys.
that's a very bony problem.
Yeah.
It's good for your mind.
I can,
Hey,
like,
Yeah, me too. You know I do that all the time with strangers. They're like touching their face. They're like, ugh. I always like touch my own face. I'm like, yeah, I feel like you're okay. And when you learn, I like
out of the way.
it's more great. Yeah. So, reconstitution. Yeah. So I do. That's a great question. My reconstitution: sterile water, bacteriostatic sterile water, 8 mLs, and then 2% lidocaine, 1 ml. Sometimes I do 9 mLs. Like sterile water for like super thin. I really just want to like hand facial it, but I don't think it matters. I was trained you to do 5, then mix it, then 3 of sterile water again, and then 2 of lidocaine. That's 8 and 2. That has to do with the clumping. That's why they're doing that. Okay, so I should keep doing that. If you're not getting clumping, do whatever. But if you're getting clumping, that's why they're doing it.
Bacteriostatic water, yes. Can you give me the 2 bottles of Lido and the water? I think, no. All right, guys. So as far as our dilution, everybody does it differently, and I believe like I'm so respectful of everyone's technique. I always have love and support for everybody. I don't think one provider is better than the other provider because now they use more still water. So I don't judge anyone. I just respect everyone's technique, and whoever your mentor is or whoever you're comfortable to learn from, just stick with them. One thing that can be super confusing, especially when you're a beginner, is like learning from this person and that person, and then you're getting yourself so confused. What worked for me is I picked 3 models, and since then I'm learning from those 3 models, and I think they're one of the best. One is Dr. Shinobe, second one is Julie Horn, and the third one is Dr. Raj Akola from UK. So I have learned my sculpture from Dr. Shinobe, and I have shadowed him for 3 times. I attended his master course in Fort Lauderdale for the first time, and then we hosted his master class here in DC, and then he's coming back again August 18, and it's going to be 2 days of training. And his belief is that perhaps he's a dermatologist, therefore he has so many modality that can help his patient with improving the skin quality. But one thing he doesn't have anything beside his sculpture to help with maintaining the bone structure. I think whether it's energy devices that we have, whether it's old therapy, Morpheus 8, Fraxel, Thermage, there's all these energy devices out there to improve the quality of the skin. But in my humble opinion, I don't know much anything besides Sculptra that can preserve my patient bone structure. And bone support matters to me because one thing happening during the aging process is, especially women, we have smaller bone to begin with. 2, women during menopause, premenopause, hormonal changes, one thing that we lose 30% is the bone support. So therefore, I'm going to do anything I can to help my patient to preserve their bone structure. I can give them volume through filler. I can give them skin tightening through the energy device Morpheus 8 that we have. But in my mind, I don't have anything else to help them with the bone. So my injection is a little bit different than Brittany, and my injection will be just focusing on the bone. So when I do my assessment, I always tell my patient, I'm like, look, I'm going to treat you like a clock. You're going to go all over the place. I'm not going to just make you look young and healthy on your upper face and neglect your lower face. And the one thing you guys will see is so typical. Look at women in their late 60s or 70s. Everything looks amazing here, and they're literally, covering their neck and the scarf because somebody neglect their neck. So if you are an artist and this is your art, you have to pay attention. You have to treat this like a whole. You're not gonna just draw a nice painting and then ignore the corner of the painting. You want to paint all over. So always remember, this is a clock as far as your neuromodulator, as far as your filler. Quickly, over neuromodulator. I know everybody knows that, but I'm just gonna focus so much on it. I will turn it on when it's ready. Yeah, I'll turn it on. So upper face, mid face, lower face. If you only focus on the upper face, your lower face muscles are depressor. That means they go down. So why would you relax someone here and then neglect the lower face muscle when we know the lower face muscles are a depressor? I feel like it should be the other way around. We have to relax things that they go down, as a matter of fact. And interesting enough, the majority of the lower face muscle, they require just a little bit of a toxin. 3 and 3 for DAO, Mentalis 6 to 8 units. So be mindful of treating your skin as a whole. Dermal filler, I love them so much, but it's not enough. It's like the simple example I use for my patient is like we want to bake a cake. And if you want to have a delicious cake, you want to use all the ingredients. You're not going to just use sugar and milk and call it a cake. No. So if you're trying to create a non-surgical prevention of a treatment for your patient, you need your neuromodulator, you need your dermal filler, you need your skin tightening, but you need your biostimulator. Otherwise, in their 50s, they're going to look off, and I will promise you that because you can see that they're walking around every day. Again, big lips, no pre-gel sulcus. The mentalis is lifted upward, so this doesn't have a support. Big cheeks and a hollow temple. And then obviously, as we age, female forehead should be nice and round. As we get older, a female forehead becomes more like masculine. It becomes very flat. So non-surgical frontoplasty is one of my very favorite treatments because I love to replace the volume loss. I love to replace the deep fat compartment for my patient. So for her, if you look at her face, go ahead and look down a little bit. So the position of the eyebrow changes a little bit because when we're young, we have lots of volume here. As we get older, we lose this volume. And this is why, again, compared to a nice round forehead, if you look at all the models, they have such a beautiful forehead. It's nice and round. So it becomes more flat. We lose the deep fat compartment, especially, go ahead and look down. You can see that she's extremely hollow in this region. Right there, you could do a non-surgical frontoplasty to give her some volume. But we're focusing on biostimulator, so we're going to focus to the temple. But keep in mind the forehead is so important. If you neglect the forehead and temple, your patient's going to look like a 30-year-old here, and they're going to look like a 60-year-old here. So for everyone who wants to look natural, I'm like, well, you already look fake because you look like 30 here and you look like 60 here. So educate your patient. So temple, why is it so important? Lateral canthus, the brow lift, yes, we can give them some brow lift through injection of toxin, but when you lose this support here, the corner of the eye goes heavy. And this is why everybody want to look like Bella Hadid. They're like, I want just a little bit of a lift here. I'm like, sweetie, you need a lot for that. One PDO thread can't do that. So temple is so important because when they're so hollow here and they have high cheekbone, there's not a nice projection. There's not a nice camouflage. It looks like depression projection. That's not smooth. That's not soft. So you want to always assess your patient's temple. Heart temple looks great actually, but I'm just bringing that to your attention because that's how you're going to give them some lateral support to the orbicularis oculi muscle and helps them with the lateral canthus, especially the corner of the eye. And as a matter of fact, it's going to help to open the eye a little bit. She has a beautiful cheekbone. One thing you guys want to pay attention to, so patient either have a beautiful high cheekbone, but they're hollow on the mid-face, or they have volume on the mid-face and they're hollow on the lateral zygomatic bone. It's either or. I have never met someone to have both of them. Like me, I have lots of mid-face, but I don't have the lateral zygomatic bone. What I want is the bone. But I have like Claudia. Can I use this? So us we're different. She has a beautiful on-point cheekbone that I don't need to do anything for her. But one thing she lacks in volume is her mid-face. And the mid-face, when we're hollow there, under the eye area, when you're hollow there, it makes you look tired. I never look tired, but she could look tired. But one thing I wish I wish I had a more high cheekbone. So for her, she has a nice mid-face support. So talking about the nasolabial fold, is this a true nasolabial fold? Is this a smile line? The smile line, go ahead and smile for me. Smile line is meaning repeating the same motion in one area over and over and over and creating this crease. That's a smile line. Nasolabial fold is because our mid-face support has been our cheekbone doesn't have the support anymore, meaning this deep fat compartment is hanging on the wrong area. So by giving her a lateral support, we're going to get rid of this deep fat or this heavy tissue from down to up. So in addition to that is the periform aperture. You lose this deep fat compartment here. So by placing her sclera or by placing some dermal filler, we're going to give her some support. Second, the LLS muscle that is responsible for lifting the lip upward. We're going to give that muscle or that region to support. So definitely we're going to help with prevention of why do you guys think the older patients, the lip disappears? One, a maxilla, the bone. Two, lose of the deep fat compartment in this region. Three, this area, the matrix support starts shifting downward and the patient becomes very heavy here. So the periform aperture is super important. Now go ahead, turn this way. She doesn't have a pre-gel sulcus, but we can give her some volume here, and then of course the angle of the mandible. The angle of the mandible, again, looking at this bone structure, basically, go ahead, turn this way. We're trying to preserve this for her. So angle of the mandible is going to contour her face and is going to also help with all the soft tissue that she has. All right, so first I'm going to start with her mid-face and her lateral zygomatic bone. And then temple, periform aperture, pre-gel sulcus, and angle of the mandible. So if you, alrighty. So my dilution, it is 6 to 1, so it's like 6 ml of water, and then 1 ml of 1% lidocaine, never with epi because of the blanching. So looking at the anatomy, if I ask you guys, what can I do to spray my medication on the bone? We're just trying to spray our sculptura in this region. So it's a deeper injection. It's a deeper, deep fat compartment. And I know one thing Brittany mentioned, and it was so valid. Yes, plastic surgeon, they don't like lots of scar tissue because when they do a deep plane, it's just lots of scar tissue and they don't like that. But then at the same time, I love to help my patient to maintain their bone structure. So that's important to me. So I'm going to start with her mid-face support and the lateral zygomatic bone. So this is the area that almost I'm going to place my product to help with the deep fat compartment and then periosteum. So I grab the tissue. I am under the muscle. So I'm going to aspirate because I am deep. And I'm going to retrograde. So 0.2 to 0.3. I'm going to reposition and a little bit more like superior. Retrograde 1, 2, 3, 4, 5. As many seconds as you wish to be safe and feel safe. 0.3. And I'm going to reposition. I'm going to lift the muscle. I am under the muscle. And my last injection, 1, 2, 3, 4, 5 seconds. Right there. And I'm retrograding. So that's my first injection point. And again, looking at the anatomy of the zygoma, this is where I'm trying to protect the mid-face support. Then my next injection, it will be more like lateral. I'm going to inject in this region because I'm trying to give her this nice lift on the lateral zygomatic bone. So I lift the tissue, I go very deep, and I can feel the periosteum. So I'm going to aspirate, couple seconds, 4 or 5, as many seconds as you feel comfortable. And I'm going to retrograde. And then I'm going to change my position. I have 0.1, so I'm just going to place that there. So my injections are very deep because my way of treating my patient is this is my only chance that I can help with the deep fat compartment and preserving and helping with the bone support. Your patient will like that. Again, I spend a lot of time with Dr. Shinobe that I have seen his patient from when they were 65 to 75, that you can see the patient bone support looks so much better, especially through 3D camera. All right, so that was my first injection for this area. For the temple, go ahead and open your mouth big for me. So when you ask your patient to open their mouth, basically they're relaxing the temporalis muscle. Second thing, I always put my finger, I'm protecting the orbit, and I'm also putting my finger here so my medication doesn't go the other way, because this is the region I'm trying to place the volume back. So straight to the periosteum. I'm going to aspirate 1, 2, 3, 4, 5, 6. Putting my finger back so my solution doesn't move forward towards the orbit. And she's going to just keep her mouth open, and I'm going to put between 0.3 to 0.5. And then I'm going to come out slow. You can now relax. And then one secret that I'm going to teach you guys, when you're injecting, when you're coming out slow, you're going to have less chance of bleeding because you're closing all those layers behind, you're tamponizing. So therefore, less bleeding for your patient. My next injection point, it's the pre-gel sulcus. Again, deeper injection. I'm going to lift the tissue upward. Sorry, it's a little uncomfortable. So I'm on the mandible, retrograde, and this is going to be a fanning technique. So one injection, the second injection, and the third injection. I'm going to reposition. I would be using a little bit more product, but I have only one vial. So again, lift the tissue, because keep in mind, there's a ligament here. What happens during the aging process? These ligaments is what connecting the skin, muscle, fat pad to the bone. And as we age, what happens to the ligament? They start shifting downward. They're not giving the skin the support anymore. So also by replacing this volume loss, we're trying to give some support to that ligament. So I lift the tissue, I'm injecting very deep. I'm going to aspirate 3, 4, 5 seconds, however you're comfortable, and I'm going to retrograde. I can feel the periosteum. I'm very deep, exactly. So for the angle of the mandible, I just go straight to as posterior as possible, and I'm exactly on the bone. I'm going to aspirate for safety, and then I'm going to put 0.3 ml of Sculptra. And then the last injection point for me will be the piriform fossa. For that, I'm going to use the 25 gauge needle. Piriform fossa is important because one, as I said, as we get older, the distance between the tip of the nose or the nose and the lip elongates. Two, we lose this deep fat compartment. So there's the light and shadow. There's a projection and depression. So by smoothing this area, by bringing volume back to this region, it's going to get rid of this hollowness and it's creating a smoother transition. So I'm going to, with my non-dominant finger, I'm going to feel for the artery. I'm going to push the artery away, like away from the danger. And I'm going to go bevel down straight to the periosteum. I always do two-hand aspiration. Like I know it looks nice that we do one-hand aspiration, but I think this is patient safety. Two-hand aspiration, you won't be wrong. It's what safety matters. And I think with two-hand aspiration, you're more accurate, so your needle is not moving. So 0.3. And then, as I said, guys, I always come out very slow. Give this a try. When you come out very slow, there's a less chance of bleeding. So you want to have a clean field. The more clean, because one day imagine you're going to be performing for the audience. You're on the stage. Sometimes you go to these conferences and the doctor or a nurse is injecting. There's like blood everywhere. You want to be as clean as possible because that makes you different from so many other providers. So in summary, what I did for her was 0.4 ml of Sculptra for the temple. By supporting the temple, you're going to create a nicer transition between the temple and zygomatic bone. Second, it's going to support the lateral portion of her brow, and it's going to help to open the eyes as well. As far as the mid-face support, she can benefit from some augmentation or some volumization around the lateral zygomatic bone, because if you look at the models, the reason models look exotic, if you remove their makeup, they don't look that good actually. They don't. But then it's like the light and shadow and the angulation is what make them look so chiseled, so sexy. It's like they look like dangerous, you know? So you want to maintain your patient bone support. Piriform aperture is going to support that Elson muscle, and that's responsible for lifting the lip upward as well. And actually, when the nose, as we get older, our nose becomes wider. So by placing volume in this region, long term, you're going to maintain this support and you're going to help the maxilla. And then for the pre-jaw sulcus, it is super important because as we lose volume here, the corner of the lip goes downward. All right, so now for the other side, I'm going to have you guys to give this a try. So who wants to start with the cheeks first? Yeah. So keep in mind, if you look at the anatomy of the bone, look, there's almost like a W. Exactly like a W is 1, 2, and 3. So when she looks this way, you're always going to, it's like a breast augmentation. It looks nicer, it looks better because it's under the muscle. So, and keep in mind that with my technique and learning from Dr. Shinobe, we're trying to also help the bone support. So your injection will be like really nice and deep. So lift the tissue and then feel for the lateral zygomatic bone and her midface. This is where you're going to inject. And then, so that's her lateral zygomatic. So first, we're going to start with the mid and then the lateral zygomatic. And then when you're grabbing the tissue, grab it from horizontal here.
So first injection pointed here.
And then hold it like that, you see? Who has a question? Any question? So I want to hear some feedback. What are your thoughts between how would you feel more comfortable? Are you more comfortable as far as if you were injecting superficial, or will you be more comfortable if you were injecting preosteum? Bevel top, yeah.
I like the deep because I feel like I would know that I'm wearing
And then go ahead.
deep
And then aspirate.
rather than like you're not supposed to be really nervous, but you're
And
not.
then 0.3 there.
For me, like as a beginner, it's more confusing.
Yeah. So now you can change. That's perfect. And I absolutely, 100%. There's no right and wrong. Like, you know how we don't do our makeup the same way. We don't drive our car the same way. We all are comfortable with what we're comfortable. And there's no right or wrong in my humble opinion. I think so. I would say why not? If they're doing 2 vials, why not? So now for the lateral zygomatic bone. So you're gonna inject from here, and it's like basically think about what can I do to spray this bone? What can I do to introduce this beautiful biostimulator to the bone to help my patient to maintain? Who here thinks when they were younger their cheekbone was like more defined, and then as they age, they losing that support. So this is all you're trying to do is you're helping your patient to maintain their skull. They maintain that bone structure.
So here, am I going 90 degrees?
And then now from here, go ahead, lift up the tissue, 30 degree, right there. And now go ahead with 2-hand aspiration. I love like my colleagues that they do and retrograde. 1-hand aspiration looks extremely cool. I love it. But for me, my patient safety, it looks more cool to me. 2-hand aspiration, because even an inch when your needle moves, that's a false aspiration. So we're gonna now. Who wants to do temple? Okay, yeah. So
You guys have done this before.
they're like a very professional nurses, absolutely. So go ahead and open. So do you remember with your 2 finger, you're going to protect the orbital rim and also here because you don't want your solution to shift backward or you don't want it to go towards the orbit. So now you're gonna feel for the periostum. Yeah, that's a good place. 90-degree. 2-hand aspiration. Open your mouth. So when they open their mouth, it relaxes the temporalis muscle. So wait like 3, 4, 5 seconds. Just take your time and then ease gently. Hold your needle with, yeah, perfect. No, that's perfect.
Also, a fun fact for you guys that when you pull back on the plungers,
0.3 should be fine.
so down to
0.3, yeah, 0.3, 0.3. Like the whole thing.
Oh, the whole thing.
That's 0.3.
Oh.
You can keep your mouth
the
open.
rest of it?
Yeah. Go slow. Perfect. Amazing. Good job, Elizabeth. You're killing it. Thank you. Awesome. And come out slow, come out slow. When you come out slow, you're closing all the layers behind you. So it's like kind of like tamponizing the layer. So it's less bleeding, less trauma to the tissue. All right. Piriform fossa. Who's the next? Next.
Yeah. Do you want this angle?
Yeah, I got you. Yes, thank you.
I'm trying not to get stabbed. Please don't mess your face up. I'm like, I'm not going to. I'm making it better.
All right. So you could do 0.3, 0.4. So turn this way. Let me lower this for you a little bit. So piriform fossa, with your non-dominant finger, push the artery away. If you give me an alcohol swab, and then more like 90-degree. Yeah, let me lower this. Bevel down. Let me go. Are you comfortable?
Mm-hmm.
Is this plugged? The bed. So pop 1, 2, 3. Sorry. All right. You're exactly on the bone. Do you feel it? Yeah. And gently, I'm going to hold this for you. Now you can aspirate. 2 hand with 2 hand. Use your both hand. Sorry. And then slowly inject the area. And don't push on the syringe because it's a sensitive area. Yeah, nice and slow. Perfect. That's great. And now come out very slow. Slow. When you come out slow, it helps to close the layer, less bleeding.
When you're coming out slow, are you coming out the same angle?
Sometimes I switch, yeah. And that's like, you're like hiding the blood behind you so you don't go through like all that dapping.
Okay, so you're trying to
Change the angle, exactly. All right, we have pre-gel sulcus. Who likes to do the pre-gel sulcus? Yes, please, of course. Turn this way. So for the pre-gel sulcus, you can just hold the tissue as deep as you can. You're under the muscle. So, and you're going to do like fanning technique, like 0.3, 0.3, 0.3. If you have like less than that, you can do 0.2 instead.
Yeah, it's 0.4.
Okay.
So you hold like
Hold the tissue.
this deep. Sorry.
Bevel down. Yes. Right there. And now go ahead with 2 hands. Hold your needle. And now go ahead aspirate. 1, 2, 3, 4, 5, 6. And now you're going to retrograde. Push and pull.
Do you hold the tissue again?
Yeah,
Or no?
yeah, good. Push and pull. And now go ahead, reposition like a fanning technique. And the same thing, you're gonna retrograde. At first, you're gonna aspirate.
Oh, aspirated.
Yeah, I always aspirate, but because I'm injecting deeper. And then, perfect. And then reposition your needle. All the way the other way. Yep. And then aspirate first. And then you can inject the rest there.
The whole thing?
Push and pull, push and pull, push and pull. More and more push and pull. Because you have a little bit left so she can get the whole thing. Perfect. And then now we're going to do the angle of the mandible.
So come out really slow and
Comes up, yeah. It helps with less bleeding.
Okay.
Look, nothing, of course. All right, the angle of the mandible. All right, this is easy. So just go ahead, turn this way. I always try to inject as posterior as possible. And the one thing, guys, now especially since we have the Volux FDA approved, I start seeing a lot of female chin is becoming very masculine. You want to be mindful. The width of the chin, it should be the same width of the fatty part of the lip or the nasal ala. I'm seeing a lot of masculine chin these days that the width is almost as width of their lips. So be mindful. The female chin, it should be nice and pointy, nothing wide. So keep that in mind. Not sculpture, no. And then the other thing with the female jawline is between like 100 to 120 degree. So we're trying to elongate the jawline, versus for men is more like a 90-degree injection with the filler to make them more boxy. So almost their jawline is the same width of their cheeks, versus for the female, we still want to be mindful to maintaining the V shape for them. So yeah, for fill the angle of the mandible and straight to the bone. And then bevel down, and you can aspirate first. Aspiration, and you can do about 0.4 to 0.5. And if you don't, I always say, if you don't feel the bone, you don't want to inject. So make sure, is it clock or?
No. I already did it.
Perfect. All right, and you can clean
Do you do
that.
anything along the jaw?
Yeah, we could do that. And then now, since we have a little bit product left, now we can do the superficial, because you could do the superficial and deep injection together. Is this something you would do? Yeah. So for her, will be just more like the preorbicular area. So can I get a pen marking? Oh, here, marking pen. So like that. And then there you go. And then I don't have a 1.5 inch to make it easier to bend, but you want to bend the needle. I hope that's enough. Let me change it to 25 gauge needle. There you go. Who wants to do, you can do one, and then whoever wants to do the next. So that's going to be more like a superficial. So you're under the skin, lift the tissue, pinch, yeah. And then nicely you're going to retrograde. Yep, that's a perfect dab. And push and pull and push and pull. Is Gigi available? Okay. Beautiful. Great work. And a great model. Thank you. Awesome. Who wants to do the other side? Yeah? So go ahead, turn this way.
I have a question.
Of course.
When you're treating the marionette lines to kind of prevent that widening of that lower lateral chin, are you just like careful about how many struts you do, or like can you bulk the chin by treating that area?
I do it. If I'm treating the chin, like you know how the corner of the lip goes downward as we age, so definitely superficial linear thread to really bring that support back. And sometimes I even go like in the lip, and I try to lift the corner of the lip upward.
I've also seen some people have like entry point here and then cannula.
And then
there.
the other, yeah.
Do you feel like that bulks
it though?
I think it would. It true because it's just like, look, you have lost so much deep fat compartment, so you just need to replace the volume loss. All right. So so three linear thread. You have actually, and I have 1.5 here.
Okay.
Left of the tissue. And then your depth, you want to be making sure you're not too deep, you're not too superficial. That's perfect. And then between 0.1 to 0.2, push and pull back, push and pull back. And now you can reposition your needle. That's perfect. And then now really for your next injection, you can go to the little bit more like posterior. Yeah, perfect. All right. Let me get a fresh needle. Yeah, we have one more. Yeah, give me two. Yeah, 20. Perfect. All right. Who wants to try next? Anyone? Yeah, of course. Let me put this in the chart.
Because I have them on already.
Oh, no worries. Anybody has any question?
Why did you decide to do the smaller amount of or not really,
Say again.
the sterile water? What did you find that you liked about
I just the way I was trained, and I'm just so used to it.
Okay.
Yeah.
Okay.
Mine. Yeah.
And then my question is, using the bacteriostatic
Water.
you use it for bacteriostatic because it then has properties in it to help prevent an infection, and also do you find it doesn't burn?
It doesn't burn. It has the burning
I
sensation.
wanted to make sure there wasn't anything else.
No, just. All right. So go ahead and turn this way. So she did the first one. So you can inject through the other, and then you're gonna lift the tissue. Perfect. Yeah, perfect. And then you're gonna put 0.1 to 0.2. Make sure you're retrograding. Push and pull back, push and pull back. And now same at entry level, you can reposition your needle. That's perfect. Uh-huh. And if you want to come out all the way to do it again, whatever you're comfortable with. Perfect. And then that's exactly when we're going to massage. This is an area that we're going to nicely massage for the patient. We have a little bit left, whoever. Yes, Marnessa, let's do it.
It's not like you can see the needle.
It's like what Brittany says, like you're under the blanket or you're under the sheet. When you're on the sheet, you can still see your needle, but you shouldn't see the color of your needle. Like you shouldn't see the gray color. You can see the needle, but not the that see the color of the needle. Mm-hmm. I would say you can do one more linear thread here. Yeah. Mm-hmm. And then have her turn this way if you want to reposition the chair, however you're comfortable, and just lift the tissue. And this is more like an injection, a superficial injection.
Doesn't matter where your bevel is.
I do bevel up. Is anybody else here do bevel up, bevel down, up? So lift it. Like 0.2. Lift the tissue.
We're doing more superficial.
Mm-hmm.
And your entry point is here.
Yep. And bevel up. And if you're always like not sure, you can always check the depth of your needle. That's perfect. A little bit more, like just go all the way in. Yes. And push and pull, push and pull. And then you can reposition and give her one more bolus, a little bit more superior. So she can get the whole syringe. Good job. Yeah. Because a lot of us would lose so much, we lose so much volume in this region. And if you take a look, everybody wants, they want to tell you what they want to look like. They're like, I just want some volume here. So this is exactly where they lost that volume. So we can really give them that volume loss from there. That's the face. From one finger to two finger, now they have the 5 finger. I'm like, honey, that's a facelift right there for sure, for sure. You can set up the snacks now. Ready? Perfect. Yes.
For the preauricular space, is there any benefit to kind of fanning out like that versus fanning out like that?
I think either or shouldn't matter. I don't know if Brittany, I want to get Brittany's opinion on that. No, I just, if as long as you're placing the volume in that region, I mean, whether you're going one direction or not. Okay, I'm going to have you to take you to other rooms so they can do your massage. I can get these two from you. Of course, you did so well. Thank you so much. I appreciate it. Thank you. All right. So you can come, Elizabeth, you can come with me. Oh, yeah, please. Just to massage her. She's getting her purse, Elizabeth. Yes, darling. I know. I love it. Come with me. All right. Have a seat. I'm going to have her come and do your.
Where am I? Oh.
For the food.